couple more case reports, one from 2018 and 2019. In the first one, the authors found KPC-producing Enterobacter in 2 dogs with clinical disease in Ohio. The same strain of Enterobacter has also been implicated in several human outbreaks. And in the second, the authors found 1 NDM producing E. coli in a wound from a dog, but they also found it was rare. It was only identified in 1 out of 191 isolates that were tested. I think this larger outbreak is really interesting. This is from a Switzerland outbreak in 2018. And here the authors did a 4-month prospective observational study to show the carriage of CRE at admission and after hospitalization in a large referral hospital for companion animals in Switzerland. And this study showed that companion animals often acquired OXA-producing E. coli quickly after their hospitalization, which is noted by the red markers. The green markers being their time of admission without the organism. Each row represents an animal's timeline, beginning with their admission screening. Green indicates the negative screen, red indicates their acquisition of CRE. And this E. coli clone was detected in 17 of 100 dogs and 4 of 34 cats after hospitalization. But only 1 of the animals was tested positive at admission. 2 positive animals were still carriers 4 months later, but were all negative by 6 months. There's also been some very limited reports of carbapenemase-producing transmission between humans and companion animals, including this report of a VIM-producing Pseudomonas from an infected dog and its owner in a domestic environment as well in Brazil. And this report found that these isolates were highly related, but the direction of transmission is unknown. We don't know. So this is really interesting, I think. It brings us many questions, ranging from, what is the ability of veterinary clinical laboratories to detect any of these organisms? The prevalence among companion animals, what is that now? How is it changing? And the risk of spread to other animals, to veterinary care providers, and to owners. And what would a public health response look like in these settings? A limited response is probably appropriate for a single case, whereas ongoing transmission might prompt something that would be much more involved. But what interventions are going to be most effective at disrupting spread in these settings, and how should this information be communicated with owners? So in summary, our containment strategy has worked well in clinical settings to detect hidden outbreaks and prevent some further spread. And this has been augmented by outstanding detection and response capabilities through the AR lab network. The emerging resistance has been most easily controlled in healthcare settings. Reports internationally and domestically indicate that CPOs are rare, but a growing concern in veterinary settings. And a coordinated approach is needed to keep animals, veterinary workers, owners, and the public safe. So thank you for that. I think I'm right up against my time, so I'm not sure if we have time for questions, but Megan, I'll defer to you.
Sounds good, thank you. I think one quick question that we received. So if you had to summarize, I know you give a lot of presentations, if you had to summarize, what is one thing that the public could take away from your presentation, or the way this individual asked the question is, what would NPR's Science Fridays host say about this topic? What do you think that you would say if you had just a soundbite to give?
That's a complicated question, and I do much less talking to the public than I do to health departments and healthcare facilities. So that's my bias, I'll just say. But I think that this is extremely concerning, but we have evidence that we can get it under control if we're willing to put the resources toward it. And it unfortunately requires a lot of work, but I think we have a lot of promising data that show that this is possible to manage. I don't think we'll ever get to zero, but I think we can keep people safer for a lot longer than if we don't intervene. And I think that's an important thing to do for everybody and for in human healthcare and for animals.
Thank you so much. And if we have time at the end, I'd love to loop back around with some additional questions for you and the other panelists. So thank you
Certainly.
again for your time. All right. So next, I'd like to introduce our next speaker. So Roxann Brooks-Motroni is the National Program Lead for Animal Health at the U.S. Department of Agriculture Agricultural Research Service. In this role, she provides strategic direction and national coordination of USDA's intramural research program focused on bacterial and parasitic diseases of importance to animal health in 9 research locations around the country. She's very involved in coordinating and communicating the agency's research on antimicrobial resistance and serves as the ARS representative on many interagency groups. She holds a doctor in veterinary medicine and a PhD in comparative pathology from the University of California, Davis, and has completed some advanced training in food animal ambulatory and production medicine at the University of Tennessee. And I also wanted to note that she continues to mentor many aspiring students in veterinary medicine and also raises beef cattle. Roxann, I don't know how you happen to find time to do all of these things in addition to your day job, but we're really looking forward to hearing your talk. She'll be updating us today on the USDA Agricultural Research Service providing solutions for agriculture. Roxann, over to you.
Thank you so much, Dr. Nichols, for that. That was really great. And really, I just go crazy trying to do it all. But anyway, it is my pleasure to be here today to talk about USDA's Agricultural Research Service and the research that we are doing to provide solutions for agriculture, specifically around antimicrobial resistance. So I am one of the national program leaders for animal health, and I co-lead a lot of our AMR efforts with Dr. Kimberly Cook, who's the national program leader for food safety. So if you're not familiar with USDA-ARS, we are the non-regulatory intramural research arm of USDA. So our entire agency is made up of federal scientists, and we conduct research to address agricultural issues of high national priority, of which AMR is obviously one. Our goal is really to try to do solution-oriented research by bringing together multiple disciplines to really look at a systems-based approach so that we can look really holistically to reduce the emergence, persistence of spread of AMR. And we really are trying to drive towards what are the solutions, and more than just characterizing genes or more than just characterizing what all is out there, what are the solutions that we need in processing facilities on the farm and in the agricultural environment so that we can continue to support business and support ranchers and farmers and all of our food safety personnel and our many, many stakeholders. So I like to show this slide. It's a little bit busy and I apologize for that, but I think as you think about in the One Health framework, AMR is in many, many different places, and there are many places to conduct research, and USDA-ARS tries to work in many of those. We have 90 different research locations across the country. Not all of those focus on AMR, but we are pretty disparate across the country, and we have 16 different national programs under which our research falls. AMR research occurs within the Food Safety National Program, the Animal Health National Program, Animal Production, Aquaculture, Soil and Air, Plant Health, and also Product Quality and New Uses. So we really touch on many, many aspects of AMR. So I was told that part of what everybody wanted to hear about was the new CARB National Action Plan, so the Combating Antibiotic Resistant Bacteria National Action Plan. And this came out of the CARB strategy in 2014, and the first National Action Plan was for 5 years, and then we recently just revised, I think it's the 2020 to 2025 National Action Plan, and that was just published, I think, a couple weeks ago. And so we ARS participated in the development of the action plan, and what I'm going to talk about is sort of the places that ARS felt that we best fit in, and what our goals are going to be to accomplish in the next year. So within this national action plan, or the new iteration of the national action plan, the goals didn't change. So goal 1 is still to slow the emergence of resistant bacteria. Goal 2 is to strengthen surveillance. Goal 3 is around diagnostic tests. Goal 4 is around new antibiotics, therapeutics, and preventive strategies. And then goal 5 is to improve international collaboration. And ARS was very involved in goals 2, 3, and 4. We didn't really feel that we had equity within goals 1 and 5. So I'll talk about what we plan to report in the next year. So under goal 2, which is to strengthen One Health surveillance efforts, there's a big push to move into the environment and to really include that as part of the One Health framework. And so objective 3.4 is to establish new capacities for collecting antibiotic resistant data from the environment, including water and soil. And ARS is very involved with EPA and the NARMS working groups to stand up pilot studies to look at this national scale testing of surface waters. And I think you all are going to hear from Dr. Jay Garland about that later on, but we are very involved right now in all of the working groups in terms of looking at how the data is going to be collected and how we are going to analyze that data and how that will be used. Under goal 3, which is to advance development of diagnostic tests, ARS, along with a lot of the interagency partners, plan to support 10 new antibiotic resistant diagnostic projects in the next year or so. Goal 4 is probably where ARS has some of the most work ongoing, and that is related to accelerating new therapeutics and alternatives to antibiotics. Under the first activity, it's sort of a basic research question, but to enhance basic research on antibiotic resistance mechanisms, as well as translational and clinical research on therapeutics, vaccines, and diagnostics. And so NIH, along with ARS and NIFA, plan to support 1,000 publications in the next year or so on all of this research related to antibiotic resistance. Additionally, we plan to support the training of new investigators and new entrants into the field, and that's with NIH as well, again, and we plan to support at least 60 new or early career investigators in the next year or so. And then under activity 3, plan to enhance interagency collaborations to accelerate research around antibiotics, therapeutics, and vaccines. And ARS plans to have at least or institute at least one of these agreements in the next year. Under the specific objectives, we plan to continue to do basic research to advance the understanding of emergent, spread, and persistence of antibiotic resistance, with the goal, of course, that as we increase our understanding, that will better inform therapeutic and preventive strategies. Under objective 2 is focused on the development of new therapeutics. ARS plans to identify at least one candidate therapeutic for agricultural use in the next year, as well as report success stories. And then under objective 3, similarly looking at new preventive strategies. So that being vaccines, decolonizing agents, things that can be used during times of stress, those kinds of things. And so we plan to support at least 2 candidates for agricultural uses in the next year, as well as provide updates through success stories. And so I think within the CARB National Action Plan, we struggled a little bit to really try to capture everything that ARS is doing, because it doesn't really lend itself too much with things that we're working on in terms of the environment and some of the things that we're working on within food safety. So I wanted to just share a couple of research highlights with you in terms of what we've been doing in the last couple of years so that you can understand a little bit of what ARS is working on and what we mean by solution-oriented research. So the first topic is related to SwineMRSA. This was obviously an issue a few years ago, and this was work that was undertaken at our National Animal Disease Center by Dr. Tracy Nicholson and Dr. Samantha Howe. and it was also funded by the National Pork Board. And the goals of the research were to address the public health concerns around MRSA. So really looking at how genetically related are isolates from swine and isolates from humans. Do common production practices like the feeding of zinc contribute to the spread and emergence of MRSA? And also, what is the potential for swine isolates to cause disease in humans? And all of this work is published, and I'm happy to share the publications with anybody who might be interested, or put you in contact with Dr. Nicholson or Dr. Howe to learn more about it. But the goal was to undertake the study, and what they showed was that there are really different antimicrobial resistance profiles between swine isolates and human isolates, and that the majority of the resistance genes were harbored on mobile genetic elements, and so there is the potential for the transfer of resistance, but more work is needed to really understand how frequently that might be happening. They also showed that there are really two distinct clades and two different bacterial families between large animal MRSA and clinical MRSA. And they also showed that the feeding of zinc didn't really necessarily contribute to the development of antimicrobial resistance. Another type of study that I wanted to talk about has to do with the environment. This work is being done at our Riverside laboratory by Drs. Daniel Ashworth and Dr. Mark Abikwe. And this sort of gets to the environmental aspect. We know that wastewater treatment effluent has antibiotics in it, as well as antibiotic resistant bacteria. And so the question becomes, what do we do about it? And that existing approaches have advantages and disadvantages. And so Dr. Abikwe and Dr. Ashworth are looking at simple, low-cost solutions that can be used to improve the antibiotic removal efficacy from wastewater treatment so that it's not getting out into the environment. And they really want to do this in a way that is going to be scalable and useful for the way that wastewater is currently treated. So what they did was they developed these filters with these different gradients, and they looked at its ability to remove 4 antibiotics: amoxicillin, cephalexin, sulfadioxine, diazine, and tetracycline. And what they found was that the system was very effective for the removal of some antibiotics, but not all antibiotics. And that they can improve the effectiveness with decreasing the flow rate, but that having dissolved organic matter decreased effectiveness, which probably isn't all that surprising given what we know about disinfection and the presence of organic matter. But that they also found that degradation across the system was probably the primary loss pathway for all the compounds. They also found that the different media layers interacted differently with the compounds, so that it really may be working with a different combination of layers might be needed to really remove the broad spectrum of antibiotic compounds found in wastewater. And so then lastly, the research that I wanted to highlight comes out of the Livestock Behavior Research Unit, Dr. Jay Johnson in Lafayette, Indiana. And this just highlights some of the work that we're doing in terms of antibiotic alternatives. So L-glutamine is an amino acid that's commonly supplemented in times of stress. It's known to inhibit inflammation and be an energy source in the intestine. And it's a common dietary supplement. And so they wanted to know whether or not it could be used as an alternative to a prophylactic antibiotic use in stressed pigs during weaning and transportation. And over a series of years, they've done a series of studies and shown that it improves pig growth performance, similarly to prophylactic dietary antibiotics. But I think what ARS's strength is that we're not just looking at, can something just improve performance? We really want to understand the mechanisms of why it improves performance, so that when we make a recommendation for ranchers or farmers to use these antibiotic alternatives, we know that it's scientifically backed and we understand why they work, and that it's not just snake oil, right? So they did further studies that showed that L-glutamine inhibits inflammatory biomarkers. as well as improves intestinal health and improves behavioral indicators of stress, and increases intestinal microbial diversity. So this is really, really well done work, and something that we're really proud of, and something that hopefully that the industry will be able to adopt to help the health and well-being of piglets. Finally, I think we are, within ARS and within USDA, we are really making an effort to get out the good work that we're doing and what the research is showing us. And so we last got our accomplishment summary out in 2016 to 2018, but we were just fortunate enough to have an ORISE fellow start with us actually just yesterday, Dr. Betty McCon, who actually did some of the L-glutamine work, who is coming on board with us to help us with communications and helping us with getting out our accomplishment summaries and putting the good work that we are doing and what we know to be scientifically accurate out there in the public. So she'll be with us for the year, and we're very excited to have her. And one of the things that she'll be working on is updating our accomplishment summary so that you can more easily access the research that ARS is doing. So with that, I'm happy to take any questions, if there are any.
Excellent. Thank you so much. We'll keep an eye here. If anybody has questions, go ahead and post those in the Q&A. So Roxann, I think I have a question. I was wondering if you might elaborate a little bit more into the future on some of the research that's ongoing to look at some of the different areas of antimicrobial use. I know one of the questions that we've had is around the dose and duration, and knowing that a lot of that data for veterinary medicine isn't, the studies aren't quite there. And so it seems like a lot of the work that's been going on to explore mechanisms and drivers of resistance also explores some of the data around duration of different antimicrobials and their use.
Yeah, that's an excellent question. I think it's something that we get asked quite a bit. It's not an area of research that ARS really is fundamentally able to address because we don't receive congressional appropriations to do that. I think it's something that FDA, CVM, is certainly looking at, and I think also APHIS from like the NOM studies and understanding why it is that people are using antibiotics or how they might use antibiotics. But it's certainly a very important question. It's just something that ARS isn't necessarily able to answer because we haven't received appropriations for doing it. But I think it's also a place where academicians can get involved, and places that NIFA and other funding agencies can also assist in answering those questions.
Thank you. So we have a question here from Philip Lobo. Some work has been done by Dean Boyd at Hanner and Nick Gabler at Iowa State on increased levels of SBM to improve piglet performance under the PRSB challenge. Could the increased level of glutamine be the reason for that improved performance?
I would say quite possibly. I think that's one of the really interesting, one of the big issues or one of the big questions that we are really trying to address is that when you start looking at, especially like the microbiome questions, or when you start looking at things within in the intestine, it may not just be a question of what bacteria are present or what viruses may be present, but that there's a really big aspect of it in terms of what are those producing, and what are the bacteria producing, and the metabolomics of what's going on in that area. And so all that to say that we're really trying, it's a very difficult question to ask and a very difficult question to answer in terms of looking at the big data and the way that you have to analyze the data of that very complex system. But for sure, I think it's possible. I'd be happy to put you in touch with Dr. Johnson to talk about that further. But it's certainly an area that we are trying to get into is understanding sort of the metabolome of the intestine and its interaction with the microbiome.
That's an excellent point. All right, to keep us on track, I think we'll go ahead and introduce our next speaker.
That's great.
So we're also looking forward to hearing from Amanda Bedoin, who is the director of the One Health Antibiotic Stewardship Collaborative at the Minnesota Department of Health, and she's also an adjunct professor at the University of Minnesota College of Veterinary Medicine. She holds a DVM degree from Cornell University, a PhD in veterinary epidemiology from the University of Minnesota, and is a diplomate of the American College of Veterinary Preventive Medicine. Dr. Bedoin has clinical experience in equine and small animal medicine, and she has worked for the Centers for Disease Control and Prevention, providing technical assistance to foreign governments and hospitals establishing antibiotic resistance surveillance. Currently, Dr. Bedoin leads stakeholders in advancement of antibiotic stewardship in human, animal, and environmental health. And Dr. Bedoin, we're looking forward to hearing more from you today. I'll turn it over to you.
Great, thank you. I'm just waiting to get control here. Okay, great. Well, thanks for that introduction, Dr. Nichols. I'm going to talk a little bit about antimicrobial use and stewardship in companion animal practice today. Antimicrobial resistance, as you all know, is a problem for both human and animal health. AVMA did recently publish a report called Antimicrobial Resistant Pathogens Affecting Animal Health in the United States. And this terrific report reviews bacteria that cause infections in agricultural animals as well as companion animals. And it describes resistance to antimicrobials that are used to treat those infections. We do know that animal pathogens are increasingly associated with resistance to first-line antimicrobials, and some of these organisms can also impact human health. If you haven't had a look at this report, I encourage you to do so. The objective is to raise awareness of the AMR threat and to encourage action. And one of the most important actions in our control is optimization of how antimicrobials are used, or antimicrobial stewardship. The AVMA report identified several pathogens of concern to our canine and feline patients, including Staphylococcus, members of the Enterobacteriaceae family, Acinetobacter, Pseudomonas, Enterococcus, and Campylobacter. The AVMA calls on veterinarians to use antimicrobials only when indicated, to use diagnostic testing to inform treatment, and to implement infection prevention and antimicrobial stewardship programs. Companion animals in their treatment are directly related to the broader problem of antimicrobial resistance. Our companion animal patients experience clinically relevant resistance. We want to ensure that we have a way to treat their infections to improve individual outcomes. And we also know that bacterial culture and sensitivity testing is not always conducted in companion animal practice. This means that antibiotics are not always well targeted, and broad spectrum antibiotics might be selected empirically. Companion animals receive medically important antimicrobials, including cephalosporins and fluoroquinolones. And as humans and animals are unavoidably connected, there is the concern for potential spread of antimicrobial resistance from humans to our pets and vice versa during direct and close contact. There's also concern about pet-to-pet transmission within household, veterinary settings, and other settings like shelters and boarding facilities. Studies have shown that people and animals do share bacterial flora in the household setting. In one study, researchers showed that couples in households with a dog share more microbiome with each other and also have an overall higher diversity of bacteria on their skin than couples who live in a household without a dog. This shows that dogs are acting as fomites, sharing and adding to the human household members' bacterial diversity. Just to explore a bit further, one of the specific groups of resistant pathogens that Alisha mentioned earlier, this is a slide on carbapenem-resistant Enterobacteriaceae, or CRE, in companion animals. This is an emerging concern for our pets as well as for people. In one example of CRE's emergence during 2018 to 2019, NDM-CRE circulated in a small animal teaching hospital with multiple patients affected. Animals who were infected with CRE were shown to have received several courses of antibiotics. As Alisha mentioned, although the sources of CRE introduction into veterinary settings are not yet known, we do know that because human and companion animals have close direct contact, transmission of CRE from person to pet and vice versa is possible. NDM-CRE has been detected also from animals in the domestic setting, including in a Finnish home where NDM-CRE was isolated from 2 dogs treated with multiple antibiotics for chronic ear infections and isolated from their owner. Although the risk to owners and pet lovers is likely low, we do need to expand our ability in veterinary medicine to detect, prevent, and communicate about these organisms. There is no routine surveillance system for CRE and for other companion animal multi-drug resistant organisms of public health importance, although the FDA Veterinary Laboratory Investigation and Response System, or VetLearn, has helped us to learn to detect these organisms, and did detect the 2018-2019 veterinary teaching hospital outbreak. Work is being done in this space, including by Dr. Nichols' team at CDC and within individual states. Especially important to the meeting today, we must focus on improving antimicrobial use through the practice of antimicrobial stewardship. Antimicrobial use drives the emergence and proliferation of resistant organisms. Antimicrobial use is also a risk factor for acquisition of multi-drug resistant organisms in both humans and animals. Antibiotic use disrupts normal flora, which leads to an easier acquisition of resistant organisms. Animals that might already be colonized with a resistant organism have a higher risk of experiencing infection when they're administered an antibiotic. And animals on an antibiotic can be more likely to transmit resistant organisms to others. AVMA has outlined core principles of antimicrobial stewardship to guide the profession. They are listed here and are commit to stewardship, advocate for a system of care to prevent common diseases, select and use antimicrobial drugs judiciously, and evaluate antimicrobial drug use practices. Educating and building expertise is also important. In addition to the stewardship framework from AVMA, small animal practitioners have access to a small number of prescribing guidelines for common conditions, including canine and feline urinary tract and respiratory tract infections and canine pyoderma. And the American College of Veterinary Internal Medicine has published a consensus statement on antimicrobial use. Sorry, the slide didn't show up very well here. In recent years, researchers and clinical partners have been learning more about how antibiotics are prescribed for small animals. A 2015 study led by Dr. Heather Fowler, who's now with the Minnesota Pork Board, showed that a broad range of antibiotics are used by veterinarians and that there are barriers to the use of diagnostics, including culture and sensitivity testing. One of the major barriers is cost. So this is something that is of importance to our initiatives for antimicrobial stewardship in small animal practice. In early publications on the issue of antibiotic stewardship, the AVMA task force speculated that inappropriate use in companion animal medicine is likely as high as inappropriate use in human healthcare. Human studies show that approximately 30% of outpatient prescriptions are inappropriate or unnecessary, and that increases to 50% for upper respiratory tract infections. Information we have on prescribing shows that there is indeed room for improvement. Areas for improvement include avoidance of prophylactic antibiotics for clean surgical procedures and appropriate drug selection for medical conditions for which veterinary guidelines exist. Banfield Pet Hospitals estimated concordance with prescribing guidelines for canine and feline conditions, showing that depending on the condition, concordance with guidelines ranged from 7% to 80%. The conditions for which small animal veterinarians struggle in regard to appropriate prescribing are actually similar to the areas in need of improvement in human prescribing, namely for urinary tract infections and respiratory tract infections. Data out of the United Kingdom show that there is limited use of culture and sensitivity testing when prescribing for cefavecin, a common broad-spectrum injectable antibiotic. This drug has also been highlighted in the United States as a target for antimicrobial stewardship. In fact, at the University of Minnesota Veterinary Medical Center, cefavecin is a drug for which pharmacy level controls are in place to make sure that appropriate use occurs. Measurement is an essential step in evaluating antimicrobial use and selection of appropriate drugs. These are both core principles of stewardship. During 2018 and 2019, Dr. Jennifer Granick and I led a study to estimate antibiotic use for canine and feline patients at the University of Minnesota Veterinary Medical Center. In addition to quantifying antibiotic use, we had two other objectives. First, to identify opportunities for antimicrobial stewardship in the veterinary teaching hospital. And second, to develop a study methodology and data collection tools to conduct a national point prevalence survey of antimicrobial use. CDC has used the point prevalence survey approach to estimate the national prevalence of antimicrobial use in human hospitals. Data were collected for all patients seen on the first Monday of every month in the Veterinary Medical Center primary care, urgent care, emergency and critical care, medicine, and surgery services. A total of 850 dogs were included in this study, 75% of which were seen on outpatient services. 44% of inpatients seen on the survey dates received one or more antibiotics. A majority of inpatient antibiotics were administered by emergency, internal medicine, and surgery services. In CDC's national studies of human hospitals, they have estimated antimicrobial use prevalence in hospitalized patients to be 49.5%. So the 44% identified in this survey at the University of Minnesota only approximates the 49.5% in human studies, but what we really look forward to doing is developing a national estimate. In our study, 21% of outpatients received an antibiotic. Most outpatient antibiotics were prescribed in urgent care and in primary care. To identify opportunities for antimicrobial stewardship, we assessed whether animals had evidence of infection at the time of antibiotic administration. 41% of animals on the survey dates had no evidence of infection. It was more common for animals receiving an antibiotic for conditions for which we have existing prescribing guidelines to have a confirmed infection. So this is positive news. It seems as though if we have prescribing guidelines, we are better at prescribing only when there's evidence of infection. Antibiotic guidelines are needed for other common conditions, and this particularly includes for gastrointestinal conditions. In our study, metronidazole was the most commonly prescribed antibiotic when there was no evidence of infection. Of note, and an important distinction from some of the human studies that have been done, 24% of outpatient prescriptions in this study were topical or otic, so in the ear, preparations. Other studies performed in both human and veterinary hospital environments have not captured the use of local antibiotics, including topical, otic, or ophthalmic preparations. They were included here because topical antibiotics are often encouraged as effective alternatives to systemic antibiotics and are frequently prescribed by general practitioners, dermatologists, and ophthalmologists. This work is just one of several initiatives at the University of Minnesota College of Veterinary Medicine Antimicrobial Resistance and Stewardship Initiative. We're leading National Antimicrobial Use Point Prevalence Survey. As I mentioned earlier, the work that we did at the Veterinary Medical Center was in anticipation of doing a national survey. We have just completed data collection from 14 participating hospitals in the Veterinary Teaching Hospital National Survey. So stay tuned for publication with a national estimate of antimicrobial use in the vet teaching hospital setting. We have also just wrapped up data collection for a pilot survey of antimicrobial use in Minnesota and North Dakota general practices. This work will inform a national point prevalence survey of antimicrobial use in general practices. And I also want to mention our high-tech approach to measuring and reporting antimicrobial use in companion animal settings. The Companion Animal Veterinary Surveillance Network, or CAVSNET, which is based on the United Kingdom's trailblazing system CAVSNET, will collect de-identified data directly from electronic medical record systems in small animal veterinary clinics. And I should say companion animal veterinary clinics, as we will also collect information from equine practices. Information on these and other initiatives can be found on the University of Minnesota College of Veterinary Medicine RC website. Also on the RC website are resources to help companion animal practitioners implement antimicrobial stewardship programs in their clinics and hospitals. One important resource is the Handbook of Antimicrobial Stewardship in Companion Animal Settings, which supports veterinary clinics of all sizes and capacities to take steps towards stewardship. The handbook is organized within the framework of AVMA's core principles, with robust descriptions of why these principles are important and examples of how they can be implemented. Checklists walk practitioners through steps to establish basic, intermediate, and advanced stewardship programs. To directly support veterinarians in antibiotic selection, we have developed a pocket guide based on published guidelines for common small animal conditions. This pocket card is available on the RC website and can be downloaded and printed. It can be posted in vet clinics and also kept as intended by the name in the pocket of veterinary practitioners. And just a quick note about how we operationalize antibiotic stewardship here in Minnesota. We approach stewardship across the human, animal, and environmental health spectra. Partnerships among Minnesota Department of Health, where I am primarily employed, and clinical, academic, and industry partners, including the description of our work in the Veterinary Medical Center, has allowed us to establish self-sustaining initiatives. So that does include this work in the companion animal space, but it also includes work that's being done in environmental health as well. Thank you, and certainly we are interested in expanding the conversation of companion animal stewardship. We also are looking for veterinary clinics that are interested in participating in our CAVSNET initiative or in the point prevalence surveys of antimicrobial use.
Thank you so much, Amanda. And I wanted to invite both Alisha and Roxann to turn on their video cameras if they're still around. I know we have about 5 minutes left in our program, and there were some additional questions that came in. So for Roxann, there was a question about what is the role of iron utilization by AR pathogens, and if you were aware of any research through ARS and funding mechanisms that you might be able to expand on.
Yeah, that's a really good question. I am sure that we have scientists who have looked at this, but I cannot recall any of that specifically or any specific research on it right now. Please feel free to send me an email if you have more specific questions, and I would be happy to figure out if there's a specific mechanism that you're looking at and try to see who might be doing some of that research.
Excellent. Thank you. All right. Any additional questions for Amanda or our other two speakers? I will say, this is for mostly Amanda and Alisha. We did get a lot of questions relating to the collaboration between the animal veterinary diagnostic labs and the human diagnostic labs or public health reference labs when it comes to detection of CRE organisms. And I was wondering if either of you wanted to expand a little bit on how that collaboration might work. Amanda, do you want to get started and give us that state perspective? And then Alisha, I'd welcome you to expand.
Okay, sorry, I was having trouble unmuting. Yes, so we are having those conversations here in Minnesota with regard to how would we detect multi-drug resistant organisms of public health concern in our veterinary settings. But not only that, but what is the responsibility for reporting and what is the relationship between our veterinary diagnostic lab and our public health lab, in particular for doing advanced susceptibility testing that might help to parse out what's going on in the vet setting.
Yeah, I think it's an important topic, and it's interesting. I think one of the questions we still have is, how are organisms getting flagged? In our experience with human hospitals and human clinical labs, up until pretty recently, the amount of carbapenem resistance or susceptibility testing that was being done was somewhat limited. And certainly the availability of follow-up testing like phenotypic testing to look for carbapenemase-producing organisms like MSIM or CARBA-NP, those types of tests were either not quite available until ARLN became something that was more well-known, and it's now available, but it's still optional for their use. So not every hospital is still identifying carbapenem resistance and then subsequently submitting those isolates for follow-up. Or genetic testing like sequencing or PCR, those types of tests. So we know that from just the human side of things that, in order to really get a handle on where these are emerging, you have to test a lot of isolates from a lot of areas. And it's still not clear, how much is happening, not clear to me, maybe it's more clear to some others on the call, how much is happening right at where the animals are coming in and at those clinical vets. I know a lot more testing capacity beyond that, but where are they getting flagged at the source so that we really can find them and do additional testing? So yeah, I think it's something we need to continue to work toward, but it's still in its infancy.
Just one other thing I wanted to mention about the relationship with laboratories and stewardship is that I think in healthcare, there's a different approach when a clinician is receiving the results of susceptibility testing. For example, all of the antibiotic susceptibility test results are not always on the sheet. And I do know that here with our large reference labs, when we get a result back, say from a canine urinary culture, it not only includes the first line drugs and susceptibility to those, but it will also include right there on the first page, for example, imipenem and drugs that should not be selected, not just first line, not just second line, but also third line. And so I think we also can communicate with diagnostic labs on the side of stewardship and thinking about, can there be some sort of cascade reporting where the information about third line drugs isn't necessarily included in the initial report. So opportunities for improvement.
Excellent. Well, thank you all for presenting today. I think it's been really great to see a little bit more about what we're learning and what's on the cutting edge of this particular topic, and look forward to seeing more in terms of some of the publications that you mentioned coming out and some of the data. Well, thank you all to those who are attending. We're going to go ahead and take a short break. We're asking that folks be back by about 2:30 p.m. Eastern time, which is about 1:30 p.m. Central time, and we'll continue on with the program from there. Thank you and enjoy the break. All right. Thank you, everyone, for continuing to join regarding the rest of the afternoon session. Our next speakers are Dr. Paul Plummer, Dr. Michael Costin, and I'm going to get to jump in on this one as well. Dr. Plummer is the Executive Director of the National Institute of Antimicrobial Resistance Research and Education, or NIAMRE, housed at the Iowa State University Research Park. NIAMRE was developed in 2018 as a result of a national search process led by the Association of Public and Land Grant Universities and the American Association of Veterinary Medical Colleges, or AAVMC, to identify a collaborative center to lead One Health efforts in antimicrobial resistance. Dr. Plummer is also a professor and holds the Anderson Chair of Veterinary Sciences in the Department of Veterinary Diagnostic and Production Animal Medicine and Veterinary Microbiology and Preventive Medicine at the Iowa State University College of Veterinary Medicine. Dr. Plummer's clinical specialty is internal medicine and infectious diseases of ruminants. We'll also be joined by Dr. Michael Costin, who is a 2003 graduate of Kansas State University College of Veterinary Medicine. Upon graduation, he worked in Wisconsin in a 4-doctor mixed animal practice. In 2004, he accepted a position in an 8-doctor dairy practice and made partner in 2006. That's a 3-year span from graduation to partner, pretty impressive. In 2012, Dr. Costin sold his partnership and took a position as a technical service veterinarian with an animal health distributor and enrolled in the University of Wisconsin Executive MBA program. Upon completion of his MBA in 2014, Dr. Costin was promoted, and currently Dr. Costin works at the American Veterinary Medical Association, where he serves as the staff liaison to the AVMA's Animal Agriculture Liaison Committee and the Committee on Antimicrobials. So welcome to both of you, and I know we're looking forward to hearing a little bit more about AVMA's work and about the emerging pathogen update that AVMA recently produced. Dr. Costin, I'll turn it over to you.
Thank you, Dr. Nichols. Dr. Nichols stated, my name is Michael Costin. I'm an assistant director with the AVMA. One of my roles there is to staff our Committee on Antimicrobials. Just a brief history, the Committee on Antimicrobials, otherwise known as the COA, was formed 5 years ago to handle antimicrobial issues for the AVMA. This comprised of 18 representatives, 9 primaries, and 9 alternates from the species-specific allied veterinary organizations, as well as public health vets, and we do have 2 at-large members. The COA is advised by representatives from CDC, USDA, FDA's CVM, and the Animal Health Institute. Their primary tasks are to prepare AVMA's responses to external stakeholders regarding antimicrobial issues, oversee AVMA's policies related to antimicrobials, and develop resources related to antimicrobials for our membership. This past year was a busy and productive year for the COA in spite of COVID. Next slide, please. This past year, the COA helped develop AVMA's responses to numerous external stakeholders. AVMA nominated Dr. Joni Sheftel, chair of the COA, to serve as a non-voting liaison to the CARB, and she was appointed. I believe it's a 2-year term. The AVMA is also a stakeholder to the U.S. delegation to the Codex Alimentarius's Task Force on Antimicrobial Resistance, which is currently reviewing 2 different documents, the Codex Code of Practice, as well as the draft guidelines on integrated surveillance on antimicrobial resistance. This past year, on 3 separate occasions, for each document, the COA reviewed proposed changes to the documents and developed comments for the AVMA, which were then submitted to the U.S. delegation. Additionally, the COA helped develop the AVMA responses to the UN's Interagency Coordination Group on Antimicrobial Resistance, to their documents, the draft terms of reference for the Independent Panel on Evidence for Action Against Antimicrobial Resistance, that's a mouthful, as well as supported the nominations of Dr. Mike Apley by American Association of Bovine Practitioners and American Association of Swine Vets, as well as the nomination of Dr. Randy Singer by the American Association of Avian Pathologists to serve on UN Interagency Coordination Group's One Health Global Leaders Group. Next. Currently, the COA is in the process of developing AVMA's response to the recently released NARM strategic plan. We are also reviewing the concept paper related to proposed changes to Appendix A. Next slide, please. COA members have also presented on several occasions this past year, highlighting AVMA resources which were developed for the AVMA by the COA. Dr. David Smith, a member of COA representing AABP, presented the white paper titled AVMA's Definitions of Antimicrobial Uses for Prevention, Control, and Treatment of Disease during AVMA's virtual convention. Additionally, Dr. Paul Plummer, who is the alternate representative for AASRP, presented our recently released resource titled Antimicrobial Resistant Pathogens Affecting Animal Health in the U.S. during AVMA's virtual convention, U.S. Animal Health Association's virtual convention, and he will be following me shortly here to give you all an update on that as well. Next slide, please. The COA has reviewed or is reviewing several AVMA policies under their oversight this year. Additionally, the COA has developed 2 more resources for the AVMA. The first is a one-pager titled Responsible Veterinary Oversight of Antibiotic Drugs in U.S. Animal Agriculture, which will be used by the AVMA's Governmental Relations Division in their advocacy efforts in DC. The second is the document referenced earlier titled Antimicrobial Resistant Pathogens Affecting Animal Health in the U.S. For more on this document, I will now turn this over to Dr. Nichols and Dr. Plummer, who led the AVMA's efforts in the development of this resource.
Thanks so much, Dr. Costin. So in 2019, CDC released a antibiotic resistance threats in the United States report. And this document was an update of the document from 2013, and it states that more than 2.8 million antibiotic resistant infections occur in the United States each year, and more than 35,000 people die as a result. You may have heard this report referenced in the news around November of last year, and I've seen it a couple times in some of the different presentations. Next, please. Now, this report includes several different, a list of several different pathogens, and they're categorized as urgent, serious, or concerning threats. And then we also have a watch list down there at the bottom. Next slide. And one of the things that I'm often asked when we're talking about this report or I'm giving a presentation and there's veterinarians or other animal health professionals in the audience is, well, how does this relate to animal health? How does this relate to the work that CDC does around One Health? And I think we all want to recognize that, of course, there is an interconnectedness around antibiotic resistance of human health, animal health, and environmental health, and how that resistance develops in each of those settings or species. Next slide. And so one of the ideas that came up was, well, oftentimes, as a veterinarian at CDC, when I get these questions, many people might actually look at the CDC threats report and start to look at whether or not those pathogens are zoonotic, and maybe then start to point them out as a concern. But one of the things that is really different and unique about our animal species is they have many pathogens that affect their health, and some of these bacterial pathogens might be resistant. So I was really excited to be a part of the team that produced the report for AVMA and to be involved. And I just wanted to highlight that I think there's a really unique aspect. If you look at the 2 different reports, you'll see that there are some pathogens that are exclusively in the CDC 2019 report, and there are some pathogens that are exclusively in the animal report. And then there's a couple pathogens that are in both. And I think that's an area for the future where we can potentially look to see some collaborations and some innovations that might be comparable across species. And then the next thing I did want to highlight is there's really a lot of current challenges that happen in human healthcare that are highlighted in the CDC report that we could potentially explore and learn on the veterinary side. Conversely, I think there are some things in the AVMA veterinary animal pathogen report that might be useful on the human health side. But it's really useful in looking at, well, how does this relate to our healthcare practices? And it was one of the questions that we also took into account when developing the AVMA report. So without further hesitation, I'll turn it over to Dr. Plummer to talk about the report.
Yes, thank you, Dr. Nichols and Dr. Costin. Appreciate the introductory information there. And so now, very briefly, we're going to talk about the antimicrobial resistance pathogens of animals report that AVMA recently released. To start with, we want to cover the goals of this report. And really, it was to highlight, as Dr. Nichols mentioned, the growing importance of antimicrobial resistance in veterinary medicine. So many times when we hear antimicrobial resistance discussed in the news, it relates to human health. And certainly that's important to us from a public health and zoonotic potential. But it's also antimicrobial resistance impacts our ability as veterinarians and producers to raise healthy animals. And we felt like it was important to highlight this, that this resistance also impacts the health and well-being of our animals and the veterinarian's ability to effectively treat these disease processes. So we look for specific bacteria responsible for animal disease that show evidence of increasing resistance. We reinforce control measures that we can take as veterinarians and producers to help mitigate these risks, and really hope that this report serves as a resource for veterinarians to make informed antimicrobial stewardship decisions. This is one tool in the toolbox of several of the different things that Dr. Bedoin and others have talked about today that veterinarians and producers can use to make these decisions, help to guide their efforts in making these decisions. And really the report, we hope, serves as a baseline for efforts to identify and monitor these select bacterial pathogens and their impact on animal health moving forward. Next slide, please. So very quickly, we're going to move through this quickly, but I want to make a couple of broad comments for folks as they go to use this report. First, with some definitions, the report is focused on acquired resistance that occurs when antimicrobials that previously worked to kill an organism loses its effectiveness. Now, we're probably all familiar with intrinsic resistance, and these were pathogens that were never susceptible to that particular antibiotic class, either due to their structure or their genetics, or for some reason, a particular class of drugs never worked for them. We don't highlight those in the report. The report is focused on the acquired resistance of these animal pathogens, for which how we're using those antimicrobials to treat and manage that disease may be influencing the speed and development of that resistance as a means of raising our awareness and concern about that. Next slide. So I also want to point out that not all tests are created equal. And so in our report, we actually use a broad information base, if you will, to inform folks of the potential for resistance. Some of that information is based off of antimicrobial susceptibility testing. And in these cases, that's where we evaluate a particular bacteria's ability to be killed by a smorgasbord or a list of different antimicrobials. And our outcome is a minimum inhibitory concentration. We heard Dr. Bedoin and others talk about how these can be used to make clinical decision making. And these are often reported out as susceptible, intermediate, or resistance. And really, these tests are kind of typically performed under the CLSI standards. And I wanted to highlight here for veterinarians and others, the Vet 09 CLSI document that is very helpful in really the interpretation of these ASTs, because they can be quite more nuanced and complicated to interpret than at the perhaps the first glance, where folks often just look for the S for susceptibility. Next slide. But we also include in this report genotypic resistance. And so in these cases, these aren't identified based on demonstrated resistance in a test tube with an antibiotic, but instead they're based on identification of genetic resistance markers. So it's important to recognize that these genetic resistance markers, while present, the correlation of those markers and the actual phenotypic expression of resistance are not always matched. And so we include those in the report because a growing body of evidence and ability to interpret these results is pushing us towards recognizing that there still is clinical value in knowing those genetic resistances. But it's important to recognize that these genetic resistance markers need to be interpreted as a heightened potential for resistance, but not demonstrated in the test tube resistance in all cases. So the report includes acquired resistance of both the genetic and the phenotypic or antimicrobial susceptibility testing. Next slide. So how do we hope that practitioners and producers are able to use this information? We hope that it allows them to be aware of what organisms we're seeing elevated resistance patterns in, and by doing so raises the clinician's awareness of potential resistance. It also, as an industry and as a veterinary profession, heightens our awareness of where potential future problems may be lying in the development of resistance that limit our ability to treat effectively some of these animal diseases. However, saying that, all clinical decisions should still be based on a full understanding of the data, the patient history, the guidance documents, and clinical experience. And that's why having a veterinary professional involved in that process is critical, because there's all these different pathways of information that have to be integrated into a single decision-making process moving forward. All right, next slide. So Dr. Nichols and others, Dr. Bedoin already mentioned antimicrobial stewardship. I'm not going to spend a lot of time on this because it's already been highlighted, but we do have in the report here an opportunity to review those principles that were discussed earlier. And so just want to make you aware of that. Next slide. I think we'll skip this slide in the interest of time. So how is the report structured? And really, as we set about developing this report, we wanted to make it user-friendly. So we structured it with ease of use in mind. And there's 4 specific sessions that are included in the report. There is a bit of repetition with each of these sections building in at a deeper level the information. So the first section includes the high-level introduction and infographics. And as we go deeper all the way down to section 4, it's the same organisms listed, the same host species, but the level of detail and the information and the deeper science that's included ratchets up with each level of these sections. And so we'll briefly go through that structure now. Next slide. So the first section is a summary of antimicrobial resistance, is a summary of some of the information we already discussed on intrinsic versus acquired resistance, and provides a good overview of that. And then it also has several infographics, an infographic on antimicrobial stewardship, as well as a summary infographic that you can see there on the top that outlines each of the host species that we cover, as well as the bacterial pathogens that were identified to have resistance. And so this infographic basically summarizes the entire report in one page and is available for independent download, printing out, posting in your clinic, or carrying in your truck, or having readily accessible. Next slide. Section 2 builds on this information, as I said, and has a 1 to 2 page document giving a high-level overview of the bacterial resistant pathogens within each of our host species. And so just very quickly here, we're going to go through those. So you can advance the slides as we go, but the first host species is dogs and cats. And then next, cattle, chicken and turkeys, equine, sheep and goats, swine, and finally fish and shrimp. Now you'll see that each of these has a color-coded band across the bottom based on the host species. And those host color-coded bands will remain the same throughout the rest of the document. So in this section 2, we have a single page that outlines each of those host species. If we now move to section 3, section 3 provides a pathogen card for each of the pathogens listed in that host species. And so there's a couple of highlights that you can advance on the slide right now. There's a section on what you need to know. There's a section on prevention actions, and a section on the resistance profile. Now, it's important to point out that these resistance profiles are the resistance either through antimicrobial susceptibility testing or genetic testing that have been identified, but they certainly do not imply that any particular isolate is going to have any or all of these resistance patterns. It's just an awareness that these are the types of resistance that we see becoming increasingly present and need to be made aware of. And then finally, section 4 provides a technical appendix for each pathogen that dives into more detail, provides the scientific evidence and the basis for which we identified these pathogens as a concern, and builds in with additional resources. I should comment that this was a report that was developed by a large number of the COA, as well as individuals within each of these species groups that we sought out as experts. So an expert panel for each of those host species groups was identified to help inform the COA representatives. These were developed, they were reviewed through a peer review process. And so acknowledgements for sure go out to Dr. Nichols and Dr. Costin, who with me were key in pulling this all together, but then the entire COA for their role, as well as those technical experts from different veterinary species groups that helped identify these organisms. Next slide. So we hope that this is of interest to you. The report is freely available to anyone, practitioners, media, anyone at the AVMA website. That link is here. Or if you go to the AVMA website and just search for antimicrobial resistance, that'll bring you to a COA landing page that has all of our antimicrobial resistance information and resources that we've developed and Dr. Costin talked about, as well as a specific link to this report. Next slide. So just a reminder that we have some other resources there. The Antimicrobial Stewardship document and checklist is there. And then for companion animal producers or veterinarians, there's some do's and don'ts of antimicrobial therapy for feline and canine. So client education posters. All right. So with that, I'll turn it back over to Dr. Nichols. I think we're close on time, so we may not have a lot of time for questions, but certainly we can be monitoring the question in the question and answers and answer those online if there are any.
All right, that sounds good. I don't see any questions at the moment in the Q&A box, but we can certainly keep an eye on those and answer them live as they come in. Thank you both so much. All right. Next, I would like to turn it over to Dr. Fowler. Dr. Heather Fowler completed her veterinary medical degree at the University of Pennsylvania School of Veterinary Medicine in 2010, a master's in public health in applied biostatistics and epidemiology at the Yale School of Public Health in 2011, and a PhD in environmental and occupational hygiene from the University of Washington School of Public Health in 2017. She is board certified in veterinary preventive medicine and has expertise in the areas of zoonotic disease, public health, worker safety and health, and One Health application. In the summer of 2017, Dr. Fowler began her work as the Director of Producer and Public Health at the National Pork Board, where she oversees public health as well as occupational safety and health issues as they relate to swine production in the United States. Thank you so much, Heather, for joining us this afternoon, and I will turn it over to you.
Thank you so much, Megan. Just want to make sure everyone can hear me all right.
We sure can.
Wonderful. So we're really excited for this next session where we'll start to focus on food animals or farm animal species as it relates to antimicrobial use and resistance. We have Dr. Bill Flynn here who will start us off with an introduction, really kind of setting the stage for what we'll hear this afternoon. Dr. Flynn has a Master's of Science of Veterinary Preventative Medicine that he received in 1987 and a DVM in 1991 from the Ohio State University. Dr. Flynn joined the FDA's CVM in 1993. He has served in various capacities at CVM, including at the Office of New Animal Drug Evaluation, with a focus primarily on issues related to therapeutic drugs for food-producing animals. From 2003 to 2008, he served as the director of CVM's Policy and Regulation staff and is currently CVM's Deputy Director for Science Policy. We're really excited to have you on here, Dr. Flynn, and without further ado, I'll pass it to you.
Great, thank you, Dr. Fowler. And thank everyone for and thanks to NIAA for the opportunity to speak with everyone this afternoon and to provide an update on activities that have been going on with CVM. Next slide, please. So just, I guess, a couple of things I did want to touch on. I think it's always important for us to step back and sort of take a look at what progress has been made or what activities have been we've been working on for the last number of years as we continue to move forward with addressing issues related to AMR. So I just kind of review a little bit of some of the important milestones, take just a couple minutes to sort of review a key roadmap that FDA has been following. We're now into our third year of a 5-year plan that we initiated in 2018. And then I spend some time walking through some of the key projects and providing some updates on where those projects are that are ongoing right now. So as far as the sort of general timeline, if we look back, really over the last 17 years or so, some of the key milestones go back to 2003 in relation specifically to food animals, where we put in place a new process for evaluating antimicrobial resistance concerns as part of the approval process. And so for all new products approved since that time, they've gone through that assessment process. So that was a significant step in terms of addressing this issue. Moving forward then, looking to other significant milestones, 2009, we began reporting out sales data. 2012 was an important milestone where we laid out a strategy for, and this is really a strategy to start looking back on the older products that were approved prior to 2003, the ones that were already on the marketplace, and identified some key risk mitigation steps, including the elimination of growth promotion use and bringing products under vet oversight. And that was really the formation of what was the Guidance 209 and then Guidance 213 initiative, which initiated in 2013 as a 3-year phase-in period that ultimately was completed in 2017 with all those target or goals met in terms of shifting all the feed and water uses of medically important antibiotics to veterinary oversight and eliminating growth promotion use. It was in 2016 when we initiated or funded some pilot projects looking at collecting antimicrobial use information. We're now in our 5th and final year of the funding of those projects. So those are providing some important data, and I think there's more work to be done there, looking forward to what is a longer term view or a long-term strategy for collecting information on antimicrobial use. Moving ahead to 2018, as I mentioned earlier, that's when we published our 5-year plan. And really a number of the items listed in that plan are ongoing now, and I'll provide a brief update on those as we go through my comments today. In 2019, sorry, just one other thing, and a couple of things initiating in 2019 was the process to shift the remaining products that are medically important to veterinary oversight. And we've also expanded upon the projects for collecting use information to fund a couple of projects related to collecting or projects for collecting that kind of information in the companion animal sector, particularly dogs and cats. Next slide, please. So the 5-year plan, just in brief, this is really focused on what are the activities that FDA or CVM can contribute to help advance or foster stewardship. What can we do to look at antimicrobial products that are in the marketplace in terms of better optimizing how those products are being used in the various veterinary sectors, again, with the intent of slowing the development of antimicrobial resistance. The 3 main kind of goal areas related to the action plan. One is really focused on the products themselves. So that's where we have sort of the most direct regulatory authority relates to the products themselves, and in terms of, and as I mentioned in the food animal sector, it's what additional risk mitigation measures can we look at or employ that will help to slow down antimicrobial resistance. And those are some of the efforts we're looking at now. And I think is also articulated in this 5-year plan is to need to look at this more broadly from a One Health standpoint, and also consider antimicrobial use in the companion animal sector, and identify what strategies may need to be implemented there to help address AMR from with respect to the use in companion animal settings. The second area really focused on sort of educational support that we can provide in terms of supporting stewardship at the level of the user of antimicrobials. And again, that's intended to be across veterinary sectors. And the third and important area relates to data collection. And certainly it's important that the measures we're taking are based on sound science, and that we have information, to provide sort of a feedback loop to assess whether or not the things we're doing are actually having a positive effect and moving the needle in the right direction. So that's an important element to that, both related to use data as well as resistance data. From an approach standpoint, I think 2 key factors is, we're trying to do this from a risk-based approach, where we're focusing our efforts and prioritizing our efforts around those drugs that are most important to human medicine, because that's where the risk is greatest in terms of loss of effectiveness of more highly important drugs, potentially has greater public health impact. And the other sort of characteristic of our strategy is to really focus on an approach that's one that's collaborative in nature, and seeking to bring all parties and stakeholders to the table to work out sort of collaborative strategies moving forward. Next slide, please. So just touching on a couple, I'll walk through a couple of the key initiatives that are ongoing now. One, which we just recently, earlier last month, published a concept paper related to a proposal for updating the process by which we list drugs, antimicrobial drugs, as to human medical importance. And again, this is somewhat foundational to our whole strategy, in the sense that we're again prioritizing our approach based on risk and sort of the human medical importance aspect. Ranking helps inform us in terms of the risk of different classes of drugs, and guides our risk management strategies. So it's important, again, that we make sure this list is scientifically sound, it's up to date. And so we did publish a paper updating that list, which again was originally established in 2003. So it's 17 years old or so. So it does need to be updated, and that's out for public comment now. We actually do have a public meeting scheduled for November 16th. So that's coming up soon, and certainly encourage folks to participate in that public meeting. Second area on this slide is, as I said back, we've already transitioned in 2017 all the feed and water uses of medically important antibiotics to veterinary oversight. What's remaining is a fairly limited number of other dosage form products, so some injectable products, some oral dosage forms that are still available as over the counter that are medically important. So we did issue a draft strategy to transition those remaining products to prescription status back in September of 2019. That went out for public comment. We are working now to finalize that plan. That plan would call for, if finalized as we proposed, for a 2-year phase-in period. We do hope, and working on trying to get that document published yet by the end of this calendar year. Still some uncertainty on the timing of that, but in any case, that will be moving forward at some point in the near future, and again would initiate a 2-year phase-in period under which those changes or those products would be shifted or transitioned from over-the-counter status to prescription. Next slide, please. Another important issue relates to better defining the durations of use, and this is particularly specific to medically important antibiotics that are approved for use in animal feeds. we did look at sort of the full inventory of products, particularly those that are approved for use in animal feed and drinking water. These were products affected under the initiative under 213 that transitioned them to prescriptions or veterinary oversight status. So these products are now under vet oversight. I think, again, in the vein of looking at other risk mitigation measures that could be taken, we looked at these set of products and recognized that, you know, improvements could be made to better define and better target when and for how long the drugs are administered. And when we looked across all those products, the water use products do have some defined durations on their label. And so the products that we've identified that do not are some of the feed use products, again, that don't have any specificity in terms of recommended durations of administration. So this is an issue that we are looking at. Again, our hope is following a similar strategy as the Appendix A update is to publish an initial concept paper, kind of laying out our initial thinking on a strategy for how to bring about these changes, which again is a significant undertaking in the sense that we want to make sure that any changes are based on science and that we have the sufficient information to look at and update these products. And again, the intent is to maintain these products in the marketplace so that they can continue to be available to address the animal health needs that they're approved for, but better target how they're being administered to help reduce the extent to which they contribute to resistance. In support of this, we have funded several projects in terms of supporting the generation of data that will be made available and published in the public domain that the sponsors of these products could potentially leverage to help support updates to the products. We've funded two projects in 2019, an additional project in 2020, and all three of those projects related to studies in cattle. Next slide, please. Tying into the sort of data collection aspect of our 5-year plan, again, it's an area where we continue to look for opportunities to enhance data collection so we have better information to inform our activities. In that vein, NARMS, National Antimicrobial Resistance Monitoring System, recently issued a strategic plan and held a public meeting to get input on that just last month. There's an open public docket to get comment on that strategic plan. And I think generally the theme in that plan is sort of looking at the NARMS program, through the sort of One Health lens and looking at areas where the program could be enhanced or expanded to look at data that would be collected to better support a sort of One Health monitoring system. The other data collection effort, which has been ongoing since 2009, is the collection and reporting on an annual basis of sales data. Again, we've been reporting that sales data out annually since 2009, and that data is expected, the last report out was for the 2018 reporting year. We expect the report for the 2019 reporting year to be coming out this December. Next slide, please. And just highlighting this provides an overview of this, and I think what we did note significantly in 2015, 16, 17, a pretty substantial reduction, essentially a 33% reduction in sales volume between 2016 and 2017, following the changes that were implemented with guidance 213. And we did see a bit of an uptick in 2018. And so obviously we'll continue to be looking at as part of the sales data that we see coming out in 2019. Of course, this is just one indicator. And from our view, I think we need to look more broadly at other information and not focus solely on sales data. Next slide, please. Also, as I mentioned, we've got antimicrobial use data collection projects that are ongoing now. In the food animal sector, I mentioned there's 2 projects that have been funded since 2016. One project focused on beef and dairy cattle, the other on swine and poultry. Again, those projects are now entering their 5th year of funding. I know one report has already been published related to the poultry project. We expect reports coming soon that would include information on the other projects for beef and swine as well. Again, from a One Health perspective, it's important to expand out to all species. We've also funded several projects, as I mentioned earlier, that are just getting underway to collect information and look at methodologies for collecting information in dogs and cats. And then lastly, too, I think overall, as I mentioned earlier, sales data is one indicator, but we think we need to look more broadly at a broad set of information when we're assessing sort of progress being made. And we are also working on a project to sort of develop a broader assessment report that works on integrating a broad set of information, including sales data, but use data, resistance data, animal demographic data, and other available information to sort of assess trends in terms of what we're seeing in terms of antimicrobial use in various food animal sectors. We're, again, hoping to have an initial draft or that report out in, hopefully this winter, maybe not by the end of this calendar year, but early first quarter next year. Next slide, please. And that's all I have for today. And I appreciate the opportunity again to speak to the group here today. Thank you.
Wonderful. Thank you, Dr. Flynn. We do have a few minutes for questions. I haven't seen any that came through here through the Q&A, so feel free to throw out your questions. In general, Dr. Flynn, it sounds like FDA CVM has been very busy with multiple projects, as well as we heard earlier from the USDA. I guess, can you just remind us of some key dates coming up? You mentioned a public meeting, November 16. You have some reports coming out before the end of the year. Can you just give us a quick reminder of those things to look out for?
Yeah, yeah, thanks, Heather. I mean, I think so. Things coming probably next up would be our public meeting on November 16th, and that's on the human medical importance ranking process. Again, that's a concept paper that's available for comment, and so that'll be the subject of the public meeting. We'll be getting further input on that concept paper. Again, that's one step in a longer process. We expect, again, another iteration where we would turn that, based on the initial comment, refine that into a more formal draft guidance and would go through another comment cycle there. So I think there's still opportunity for a number of opportunities for input on that document. And then I guess in November, the next coming up would be, or I'm sorry, in December, probably the first half of the month, we do expect, again, the sales report, the annual sales report, summary report for the 2019 reporting year to come out, as well as the latest NARMS report we do expect in December as well. I think that will include up to the 2018 year for NARMS. So that's another report that will be coming out in December.
Thank you for that recap. Again, any other questions for Dr. Flynn before we hear from our representatives from the field? Not seeing any come in. Again, thank you so much, Dr. Flynn. We're excited to hear about future events or upcoming events with the FDA. Again, you've sounded very busy, or you have been very busy and working in a very One Health way. So we continue to look forward to those updates.
Thank you.
So now I want to introduce what will actually be a panel of representatives of the various food animal species, starting with Dr. Greg Habing. So we have a total of 5 speakers during this session. We'll go from one talk to another, so feel free to submit your questions as we go along, and then we'll reserve some time at the very end, 20 minutes or so for your questions. As you can see here, Dr. Habing is a veterinary epidemiologist at the College of Veterinary Medicine in the Department of Veterinary Preventative Medicine, or excuse me, Veterinary Preventative Medicine. at the Ohio State University. Before coming to Ohio State, Dr. Habing was a practicing veterinarian focused on dairy production systems. His research team at OSU, the One Herd Lab, combines production systems experience with expertise in traditional and molecular epidemiology to address critical One Health problems, including antimicrobial stewardship and foodborne transmission of pathogens. Dr. Habing.
Yes, thanks very much for the introduction. So I'm really grateful for the opportunity to talk about antibiotic stewardship and veal production systems and some of our activity. And just to note that this is very much a collaborative effort with Dr. Jessica Pinpeck and Marty Masterson, both of whom are at Ohio State. So as was mentioned, I started off in dairy practice. I'm a veterinary epidemiologist now at Ohio State, but I very much identify as a dairy practitioner. And I left practice to do a residency and a PhD at Michigan State. But the best educational experience I got was working with producers in Franklin County, Pennsylvania. So I learned a lot there. So we have a lot of interest in our lab in antibiotic stewardship, and we try to take a holistic approach, including looking at factors that impact animal susceptibility and exposure to infectious agents, but also the human element to antibiotic stewardship. So the decision-making that producers have to make on a routine basis. So producers have this responsibility for initiating antibiotic treatments. So a couple of brief take-home messages, just kind of to start at the end. So number one, in the male calf production chain, there are substantial challenges because it's disaggregated. In other words, the calf changes hands multiple times. And two, there are opportunities to reduce antibiotic use through both prevention and more targeted use. So the male calf production chain, of course, starts on the dairy farm, and dairy producers are responsible for the early life care for calves, including colostrum practices that to a certain extent determine the health outcomes for the next few months. Yet the calves leave the farm within the first week of life. So based on some qualitative work that we're doing right now, most farmers don't know where their calves end up ultimately, and they don't have that relationship with the growers, but they believe that they do well. So this could lead to, or in some instances does lead to, discrepantly worse care on farms. So after they leave, most calves are marketed through auctions. So they're aggregated in these environments where there's a lot of other species and the environment is essentially not cleaned on a routine basis. So for instance, we did some work with the Departments of Agriculture in Ohio and Wisconsin, and virtually every environmental sample that we collected was positive for Salmonella. And so that includes strains of Salmonella that are commonly responsible for outbreaks in calves and people, including Salmonella typhimurium and Dublin and Salmonella Newport. So after they leave the auction, they're disseminated out through farms in the East and the Midwest. And so they're transported on trailers, and sometimes the trailer ride is 12 to 14 hours. And so that's additional stress on the calves. So they start off as very susceptible. They're aggregated within auctions and then distributed out to multiple states. And so it's kind of a good way to disseminate multi-drug resistant pathogens really. And so the result of all this is that when the calves get to the veal grower on arrival, there's a substantial proportion of calves that have failure of passive transfer. About 35% are dehydrated. About 27% have naval infections. And so veal growers really have an uphill battle in terms of improving antibiotic stewardship and preventing disease. And so the end result of that can be a lot of antibiotic use because of this disaggregation within the male calf production chain. So despite that, I should note that the veal producers, the formula-fed veal producers, have done a good job for residue avoidance. So based on the 2019 Red Book, there were 0 residues within formula-fed veal. So we're kind of strictly talking about reducing antibiotic use rather than avoiding antibiotic residues. We did a survey amongst veal producers within 2 production systems, and our goal was to measure targeted antibiotic use amongst these producers. And so we did that by giving vignettes to the producers that had descriptions of cases of increasing severity. So cases 1, 2, 3, and 4 were of increasing severity. So about 2/3 of the producers said that they would normally use antibiotics for cases where the veterinarian written protocol said that antibiotics were not indicated. So there was certainly opportunity to better target antibiotic use towards only those cases where the protocol would say that antibiotic use was indicated. So there was a protocol, it's just the adherence to those protocols could be improved. So we implemented some antibiotic stewardship training within these veal production systems. And so that included in-person training and training on decision tree protocols to help them better target antibiotic use. And this was implemented on a relatively small subset of farms. So 4 cohorts, 4 farmers got that antibiotic stewardship training. And there were 4 farms, control farms, that didn't get the training, but we still took the measurements. And so we measured knowledge and attitudes, treatment accuracy relative to the veterinarian. And then we quantified antibiotic use using a collection of their containers that they used for that grow. So again, the in-person training included topics like what is an antibiotic? What is antibiotic resistance? How do we target, or how do we make decisions on when antibiotics are necessary or unnecessary? And to that end, so producers would need a little bit of skills for clinical evaluation. So for instance, how to identify and score a calf that's dehydrated. And those clinical evaluation skills can then be incorporated by the veterinarian of record into decision tree protocols. So the producers can use this as a support tool to better target antibiotic use. So getting into a little bit of the results of that. So certainly before and after the training, the producers had more knowledge, thank goodness. So for instance, they were better able to identify which of these products was an antibiotic and which was not an antibiotic. And their overall assessment scores were higher after the training than before the training. So that was good news. So as I mentioned, we assessed treatment accuracy. So the producer and the veterinarian evaluated the same calves and made treatment decisions. And we looked at the agreement between the vet and the producer. And so in cases where the vet had decided that antibiotics were necessary, those producers that had gotten the intervention had higher diagnostic sensitivity. They were more likely to also agree that they should be given antibiotics. So that's good news from a welfare standpoint. On the flip side, for those cases where the veterinarian had said the calf is sick, but antibiotics are not necessary, still producers that had received the intervention were more likely to give antibiotics. So we improved the diagnostic sensitivity and we sacrificed the diagnostic specificity. So as I mentioned, we also quantified antibiotic use within these cohorts where we were able to. So on the x-axis is the cohort number, the grower, and on the y-axis is the treatment incidence, or the doses per calf per 100 days. And so on average, a calf would get 18 doses per 100 days. And that could be either individual treatments, parenteral treatments that are in the gray bars, or group treatments primarily administered through the water in the blue bars. So a lot of variation in the quantity of antibiotic use between cohorts, and a lot of variation in the proportion of antibiotic use that was either individual or group treatments. So we quantified that for both control herds and for herds that had received the intervention. And the antibiotic use, the quantified antibiotic use, was numerically lower for those that had received the intervention, although that's not statistically significant. I need to find a way to analyze it, so it is statistically significant. But at least the numbers are trending in the right direction, so numerically lower antibiotic use for those producers that had received that antibiotic stewardship training. So we're planning to work with BQA, which is a component of BQA, to extend some of these training and resources out through calf producers in the Midwest. On the research side, we're currently working with the University of Guelph to identify other influencers or barriers for optimal early life care for male calves on dairy farms, and then also measuring the effect of incentives or benchmarking on how calves are given colostrum or other care amongst dairy farm personnel. So potentially closing that feedback loop that I mentioned at the beginning. So with that, I'd be happy to take questions on any of this.
Sorry about that. So we'll actually continue on with the panel, and I ask that the participants go ahead and submit your questions. We already have a question in there for Dr. Flynn that we can come to at the end of the panel. So again, thank you so much, Dr. Habing. Now we're going to move on to Dr. Capel. Dr. Michael Capel, and I hope I'm saying your last name correctly, has been a private practitioner in Western New York since graduating from the Cornell College of Vet Med in 2000. He has been a partner at the Perry Veterinary Clinic for 18 years and focuses on dairy cattle with an emphasis on milk quality, nutrition, antimicrobial stewardship, and clinical research. Dr. Capel, we're excited to have you present today.
Super. I'm really excited to be here. Can everybody hear me okay?
Yes, we can.
Perfect. Thank you, Dr. Fowler, for that introduction. I've really appreciated the opportunity to attend the conference so far and hear from all of the different contributors to this important topic in this great symposium. As was introduced, I am in private clinical dairy practice. Our practice is located south of Rochester in Western New York and just east of Buffalo. We have 4 small animal clinics, but we also work primarily with dairy on the large animal side, and we work with about 250 dairy farms and service about 150,000 dairy cattle in Western New York. And in addition to clinical practice, I've had the great fortune to be close to the University of Guelph and close to Cornell University, and have been involved in a fair amount of field research in udder health and nutrition and a variety of other topics. So it's really been a super opportunity for me. And I'm going to speak on some of the projects that I've been involved in today, specifically on the topic of udder health. Well, antimicrobial stewardship, we really think, first and foremost about prevention. What I'm going to talk today about is changes in therapy and overall reduction in antimicrobial use in the dairy industry. And I'm going to start out by reviewing some NAMS, National Animal Health Monitoring Service, data from 2014, the last time that they did a major dairy review, and discuss just the magnitude of mastitis, that mastitis is a problem in our industry, and the opportunity that we have for reduction in antimicrobial use. So mastitis, just to review, is an infection of the udder and the milk-producing tissues of the cow. It's a disease of great importance to the dairy cow. It can cause significant production loss, it's a welfare issue due to the pain involved in it, and it causes premature culling. And it also represents probably the largest amount of antimicrobial use in the dairy industry, in the adult cows in the dairy industry. Treatment and control of mastitis accounts for probably about 2/3 of all the antimicrobial use in adult dairy cows, referring just to adult dairy cows, not the veal calves or the young stock that we've talked about a little bit before. And it's also a fairly high incidence disease. We have about 25% of our cows are affected with clinical mastitis each lactation. And if we look at the amount of those cows that receive antibiotics, about 90% of them receive either intramammary antibiotics or systemic antibiotics to treat those mastitis case. At least that was according to the 2014 2014 NOMS data there. You can see that we've got a pretty big impact here, a pretty big opportunity to make an impact in reducing them if we can look at different strategies for therapy for clinical mastitis. Next slide, if we can. There we are. So what I'd like to talk about regarding therapy of clinical mastitis is pathogen-based mastitis therapy. Mastitis is primarily caused by bacterial pathogens. And while every farm has their own bacterial ecology, on a genus and species level, there's really only about 10 or 15 pathogens that cause the vast majority of clinical mastitis. Additionally, varying from farm to farm, roughly about 20 to 40% of cases, we're not able to identify any pathogen at all. So if we take those two together, there's a growing body of evidence that suggests that only a real small number of the bacteria that cause mastitis actually respond to antibiotics, and most of those are in the strep family. So there's a great opportunity if we look at mastitis cases to identify the mastitis case, the pathogen that's causing the mastitis case, and then use that data to prospectively determine which cows should get treated with antibiotics and which cows shouldn't get treated with antibiotics or would respond the same way on their own with just supportive care. And again, here we're talking primarily about non-severe cases of mastitis. The severe cases of mastitis would require significantly more therapy, systemic antibiotic therapy, IV fluid therapy, anti-inflammatory therapy, where we're talking primarily about non-severe cases of mastitis, which occur just at the quarter level or the udder level. Several trials from Wisconsin, California, I've listed one here that I was involved with in New York State, have demonstrated that pathogen-based therapy, as compared to blanket therapy where everyone gets treated, pathogen-based therapy can reduce antibiotic use by about 60 to 70%. Again, we're just targeting the pathogens that respond to antibiotics and have been shown to respond to antibiotics, primarily those in the strep family. And we can reduce antibiotic usage by about 60 to 70% with no negative impact on clinical outcomes. So these are cows that don't have reduced production compared to those that were treated with blanket therapy, don't leave the herd any more frequently than those that were treated with blanket therapy, and don't have any additional recurring cases of mastitis or any increase in somatic cell count, which is a measure of infection status in the udder. So really some great work within the last 3 to 5 years that demonstrates that by prospectively identifying the pathogen causing mastitis, that we can make a significant reduction in antibiotic use by only targeting those cases of mastitis that would respond to antibiotics versus the historical approach, which was a blanket therapy type approach. So really exciting work on the clinical mastitis therapy front. I'm going to switch gears now, and we're going to talk a little bit about dry cow therapy. And dry cow therapy is an antimicrobial therapy that would occur at the time of dry off. Dry off is when, at the end of a cow's lactation, when she would stop producing milk and she would get dried off and prepare for having her calf the next time. So the udder's allowed to involute, she's allowed to have a little bit of a rest period, and that would be a period of about 60 days or so. Probably one of the most successful recommendations that the veterinary industry has ever had to the dairy industry has been the use and implementation of broad spectrum blanket dry cow therapy. And that was brought up in probably 1970s, and it was a key component of improving milk quality. And you can see from the NOMS data that I've listed here that about 93% of all cows receive blanket dry cow therapy. and about 80% of all farms employ blanket dry cow therapy. So fairly large number of animals are receiving blanket therapy at this dry off period, which is one of the highest periods and time periods in the cow's lactation for risk of mastitis. So if we can impact that, or we can change that, we can have a significant reduction in antibiotic use. Now, why, if this was one of the key components of enhancing and improving milk quality in the 70s and early on, do we think is it going to work now? And there's a few things I've listed on this slide that would indicate why the industry maybe has changed. And I think we've made some significant progress in overall udder health and prevention of mastitis and control of mastitis on the dairy farm. Data from the mid-80s would suggest that only about 40% or 44% of cows were truly culture negative at the time of dry off. And recent data would say that that might be upwards of 90%. So far fewer cows actually have an infection at the time of dry off, therefore not needing antibiotics. The National Bulk Tank somatic cell average, and somatic cells are an indicator of epithelial cells and white blood cells in the milk, which can be an indicator of mastitis infection. Usually a basic cut point would be about 200,000, and above that, the cow is at a higher risk for having an infection. Under 200,000, the cow would be at a much lower risk for having an infection. So significant reduction in the last 20 years or so in the nation's herd bulk tank somatic cell average, going from almost 300,000 in the late 90s to where it is under 200,000 now. So again, improving infection status and a little bit healthy overall. And then if we look at actual cows that are tested on a monthly basis for their somatic cell level, the percentage that tested high, most certainly infected, that is about 400,000 or above, has also decreased significantly. So we're only about 11% now in recent data versus about 30%, not quite 30% in the mid-90s. So again, overall, there's a significant improvement in udder health on the dairy farm, and I think that sets us up to consider using a selective dry cow therapy approach where we don't have to have blanket therapy for all cows. You can switch to the next slide. So selective dry cow therapy is basically targeted use of antimicrobials at the cow, or potentially even at the quarter level when she dries off. And this area has received significant attention in the last 5 years. There's several different ways that the researchers have established a cow's risk for infection or try to determine her infection status. One approach would be to actually culture that cow at dry off and determine if there are bacteria present or not. And if they are, we would use antimicrobials in that situation. And another one would be to use an algorithm-based approach where we would look at number of cases of mastitis that cow had, recency to the last case of mastitis, and if they were on a monthly test system, the number of times that cow had a monthly milk test where her somatic cell was elevated, or the indices of infection are indicated to be there. So we can use either a culture program or a algorithm-based program. And there's been some great work comparing blanket therapy to culture alone, blanket therapy to the algorithm alone, and some recent work out of Minnesota comparing the blanket therapy to both culture and algorithm at the same time. And they have demonstrated, depending upon the herd, greater than 50% reduction in antimicrobial usage by using just standard dry off techniques, which would use an internal teat sealant on uninfected animals, and using antimicrobials and a teat sealant on infected animals. So super opportunity for reducing antibiotics and antimicrobial use in cows at dry off by trying to establish the animal's risk at dry off and using that to make a decision as to whether antibiotics or antimicrobials are needed or not at the time of dry off. So just a brief review of two really neat techniques that we have done a lot of research in the last 5 to 8 years in the dairy industry. And you know, when we consider the 9.3 million dairy cows in the United States, and we consider that we can take one of the most highest incidence diseases that attributes to the majority of antibiotic use, vast majority of antibiotic use in the dairy cow, and we can reduce the antibiotic use in those diseases. It's really exciting, and I've adopted this on the vast majority of herds that I work with, and I know that these techniques are being adopted and continue to be researched and implemented abroad in the rest of the country and elsewhere as well. So really exciting work. I'm happy to share with you, and with that, I'll turn it over.
Thank you. So next up, we have Dr. Miles Thurr. Dr. Thurr, let's see, apologize. Dr. Thurr grew up on a family farm and cow-calf operation in South Central Kansas. He studied a dual degree or completed a dual degree DVM PhD at the Kansas State University. His PhD was in epidemiology, focusing on experimental design and statistical analysis. Currently, he's a research director for veterinary research and consulting services and evaluates data for the consulting group and their clients. Over to you, Dr. Thurr.
Thank you, Dr. Fowler. Appreciate the opportunity to present here today, and look forward to the discussion that we will have throughout the presentation. So kind of wanted to give you an update from in the field, follow up from guidance 209 and 213, primarily from the beef side. A little bit just about VRCS, so Veterinary Research and Consultative Services. We're primarily a feed yard veterinary consulting group, but there's 11 of us that collaborate together, and you can see all of our collaborators there listed below. But it's 11 veterinary think tank, and so we are able to bounce off ideas and come together with a plan and protocol for each one of our consultants in our practices where we perform services. So here's a map that's kind of outlines some of the geographical regions that we provide consulting services for. You can see there with the blue dots, primarily we focus primarily on the feed yard side. We do a little backgrounding operations as well, and a couple dairies as well, but predominantly feed yard groups. And so there's over 70 feed yards that we're providing consulting services for, from Texas to Washington and everywhere in between. They're here in the United States. Next slide, please. So a lot of what we do as consulting veterinarians, we really educate a lot on the case definition. So we work with the feedlot crews to accurately, to the best of our ability, identify the disease and select the appropriate treatment protocol. So a lot of this is based upon visual appraisal, and so there's always room for human error with that, but we work with a lot with the crews there into the field, overseeing, looking at what they're seeing and training them, as was presented earlier. With here are the clinical signs that's related towards bovine respiratory disease or lameness, foot rots, various diseases that we see on a day-to-day basis. And then follow up with any diagnostic tools that are effectively to be used into the field. So commonly for respiratory disease, we use a rectal temperature. And so looking at that from a gauge to see if showing the clinical signs and the calf is febrile, then we'll go ahead and enter treatments. If it's not febrile, calf does not look sick, we work with the Respiratory Observe program where we withhold antibiotic treatments and look at the severity of the case. And so after the crew works and decides we get an appropriate diagnosis, we go through our computer treatment screens and enter in the regimens into the system. And so with that, once the regimens are entered appropriately, it will automatically provide the personnel to treat with how much antibiotic and which antibiotic to give that's appropriate for, that's all agreed upon and appropriate for the syndrome. So a lot of the time is education of the personnel on appropriate visual diagnosis to recognize what they see, as well as educating them to enter this information into the computer system to provide accurate information. And so all of this was being done before Guidance 209 and 213 with our clients. But it gave us further emphasizes to make sure that we're staying compliant and resulting in the ultimate health and outcomes of all of our cattle. Next slide, please. So here's kind of one of the examples from product selection. So laryngeal necrobacillus diphtheria, it's a disease of the respiratory system that we see in feedlot cattle, but it's not bovine respiratory disease or BRD. Fusobacterium necrophorum is our primarily bacterial agent that is involved with diphtheria. So, for example, fluoroquinolones cannot be used for this condition legally. It's illegal because it is not bovine respiratory disease, as what is stated on the product label, and also most likely won't work due to the drug spectrum that's involved with the product selection. And so with that, it takes a lot of training, training with the personnel to identify here's a difference between diphtheria case and here's bovine respiratory disease. And so a lot of that education standpoint to making sure that we're treating the appropriate syndrome and entering that information into the computer appropriately, that allows us for appropriate tracking and results in complete compliance throughout the supply chain. Next slide, please. So with the veterinary feed directive, VFDs, Dr. Flynn went over really well, and others throughout the day. All medically important antimicrobials administered through the feed now do require a VFD. So in the feedlot side, the primary agents that we work with, that would be tylosin and chlorotetracycline, or CTC, would be the main antimicrobials impacted that now falls underneath this category. And so we have to ensure that the product is labeled to be fed in combination with the approved products. Take, for example, Orbamycin with CTC is not to be fed in combination with Rumensin. Co-feeding clearance is not approved. And so we have to making sure that when we issue those VFDs over, not only that it's labeled correctly with the VFD, but making sure that the feed yard is able to implement that system in a case by case, in the appropriate manner. So the way VRCS handles the use of CTC is on a case-by-case basis. We work with our crew and we issue those for a specific group of cattle there at the feed yard. And that is what the VFD is there valid for. And then if there's another group of cattle that's that the feed yard is wanting to use CTC with, it's lots of discussion over what they're seeing, origin, looking at records, as well as being there on site due to our routine consulting visits for knowledge over when and where the crew are applying the results. But then we will issue those on a case-by-case basis. For the issue for the VFD for tylosin, since primarily if the art is feeding from tylosin, we estimate that as the cattle to be fed over a 6-month period, and that is where we set and establish the VFDs for those products. So the use of the VFD is something different. That's been a change since Guidance 209 and 213 have come out. It's been something that we worked a lot with education from management, feed management, all the way through the feed yard production chain to making sure that everyone's staying compliant in the most effective way possible. So I believe next slide. And so that kind of sums up my presentation. I know we're going to hold off questions till the end, so I look forward to hearing from all of you.
Thank you for that presentation and overview of their activities at your center. Now we're going to switch up a little bit, switch up different species, move away from the ruminants for a second there. And I want to introduce Dr. Scott D. from the Pipestone Veterinary Service. Dr. D earned his DVM, MS, and PhD from the University of Minnesota. He's also a board certified veterinary microbiologist and a past president of the American Association of Swine Veterinarians. In 2011, Scott joined Pipestone Veterinary Services, where he currently serves as the director of Pipestone Applied Research, or PAR, a business unit that conducts collaborative research efforts with production companies across North America and Asia, comprising approximately 2 million sows. With that said, Dr. D, we're excited to hear your presentation.
Thank you, Dr. Fowler. I really appreciate the time here and this invitation to join the meeting. As mentioned, I'm from Pipestone Veterinary Services. Pipestone Veterinary Services has, I think, 45 veterinarians now, over 6 clinics, providing management services to 75 sow farms and 300,000 total sows, the 3rd largest production company in the United States. We can also take care of those pigs from weeding to market. We can set up marketing contracts. We can process those pigs. And we have business units in China as well as Latin America. So it's coming from the university. It's a real fun place to work. I really enjoy it. And if you've been to this meeting in the past, you may have heard Dr. Joel Neerum present on our Pipestone antibiotic resistance tracker. And I'm going to build on that. Joel talked about the responsible use side. I'm going to talk a little bit about that as a review, but also then get into some of the newer work we're doing with tracking resistance. So next slide, please. So just a brief review on PART that Joel went over a year or so ago. We launched this in 2017. It's an interactive web-based tool. It tracks and benchmarks antimicrobial use on farms. It's funded 100% by Pipestone. You can see some of the statistics that are involved with the initiative at this time. A large number of producers and sites, quite a few pigs. The veterinarians are very involved in this. 25 of our 40 veterinarians are pig focused, and they're on this every day, going to farms and looking at records on antimicrobial use. Next slide, please. You probably saw some of these charts last time. These are just a couple examples I'm going to show you on how the program can actually work. This is obviously a producer example. It's looking at antibiotic use, either in water soluble, feed, and injectable over time. And so on the y-axis on the left, you see grams per pig, which is our metric that we rely on. And then x-axis, you see months. And then you see various bars, which are cumulative use of the 3 types of antimicrobials, water, injectable, and feed, summed up all together. So that's an individual producer. We follow that at each farm, but the next slide will show you a benchmarking approach, taking all the producers in the PART program, percent producers on the y-axis, various time intervals, 6-month intervals on the x-axis, and then based on antibiotic use, least, intermediate, and most, based on some data we've compiled from the PART program, we can categorize those producers by level of use. And so collectively, you see each column showing, the number of producers with the most antibiotic use, the intermediate antibiotic use, so red, yellow, and then green lowest. And then the blue line is the individual producer, his or her data tracked across the entire data set. So those are some nice ways to look at antibiotic use at the farm level, but also across the whole group. Next, please. So what's been missing over time, and we've heard it mentioned already, is AMR surveillance on the farm. There's a lot of great work looking at the resistance on the human health level, the food safety level, but really at the especially at the pig farm level, there's not much that's been done lately. So we wanted to attack that. Next slide, please. And we've been tracking this for some time. We call it pig level. This is looking at 5 bacteria: E. coli, Glasserella parasuis, Actinobacillus suis, Strep suis, and Salmonella. We're looking at case data from our clinics sent to 3 different diagnostic labs: South Dakota State University, Iowa State University, and University of Minnesota. So this is 6,000 cases over time. We've developed a resistance index you see there on the y-axis, and it allows us to kind of track resistance over time. And time obviously is on the x-axis. So this is from 2003 data all the way up to current. And basically what we kind of see here is resistance, at least based on the conditions of this analysis, is relatively flat for a long period of time, which was surprising to us. It's not going up like you hear about in a lot of these comments made perhaps in popular press. Next slide, please. What I've been doing a lot the last couple of years is to look at the environment. I think, we can track resistance at the pig level, but tracking at the environment level, I think, is an important component of looking at resistance, conducting surveillance at the level of the environment. So I developed an environmental surveillance monitoring program targeting the 4 NARMS pathogens. We appreciate what NARMS is doing. We want to model our efforts after NARMS. So we're tracking Enterococcus, E. coli, Salmonella, and Campylobacter. You see, I did a project the last couple of years looking at resistance across those 4 pathogens at the pig farm level, also up in the upper right-hand corner at the children's playground in town, lower right-hand corner, the wastewater treatment plant in town, and then in the companion animal sector of one of our clinics. And so looking at, are there any differences across resistance levels of those NARMS pathogens at those 4 sites? Next slide. So that rolled us into what we call the Imagine project. And this is a current project going on right now. And I'm really excited about this project. I think it's just what the swine industry needs. The objectives are to conduct AMR surveillance on commercial pig farms, looking at pathogens of food safety importance, i.e. in the NARMS, organisms, the 4 pathogens of NARMS tracks. Then also our 5 pathogens of veterinary importance that I mentioned briefly a minute ago. So we're going to track those levels of resistance across those pathogens. We're going to compare those levels of resistance with our antibiotic use data. So as our part data is rolling along, collecting usage data, we're going to compare that with resistance data on these farms. And ideally, we'd like to try to validate a model of AMR surveillance that the industry could use to try to benefit the US swine industry. And so that's kind of some of the goals of the Imagine project. Next slide, please. So final slide, just giving you a little summary into what Imagine has done. This is the first year of its kickoff. It involves 160 sites. These are all of our managed cell farms, plus a number of wean to finish producers. These are being tested twice a year using our environmental sampling program. So it's 320 sampling events. As I mentioned, we're collecting pathogens at the environmental level, targeting NARMS, as well as in healthy pigs and in sick pigs, again, tracking our 5 swine pathogens in pigs that are healthy and have not received antibiotics versus those which are sick and have received. Basically, the phenotypic data are compiled at South Dakota State University, and we're sending cohorts of isolates down to USDA, to Jonathan Fry and Charlene Jackson for genotypic comparison, just to be sure we get good corroboration between what's happening at the phenotypic level and the genotypic level. So this program is nice. It's based on pivot tables, really, and it's very flexible. It allows you to ask a lot of questions as the data set builds and builds over time. So some ideas that we've had, let's look at frequency of recovery of the organisms we're targeting. How often do we find them? And let's look at trends in resistance over time. Look at trends in resistance over time with usage data. Then look at, we can actually tease it out by critically important drugs. Are we seeing a change in resistance there? We can tease it out by microorganism. So we can look at it individually by individual microorganisms or collectively, as I mentioned. So we can really kind of peel this apart and look at it at multiple levels, which makes it really cool as we start to ask new questions. And at duration, we think this is a long, multi-year ambition. we don't think we can do this correctly in 1 year. We're thinking we need 5 or 10 years to pull this off. So right now we're in the process of securing second year funding. And I'll close with thanking some of the groups there you see in the yellow box, the National Pork Board, who was the first group to step up and provide funds. FAR and ICASA came shortly thereafter. There's a lot of our own money in this as well. And obviously we're seeking other collaborators that want to work together. So with that, that's what's happening in Pipestone at the level of the swine farm as it pertains to tracking use and antimicrobial resistance surveillance. So thank you, Dr. Fowler, and everybody for the chance to join this meeting. Looking forward to the discussion.
Thank you. And I wanted to point. Looks like I muted myself in mid-sentence there, but I wanted to point out that Pipestone was the site host for our public health farm tour last year when we were able to host that in person. And so Dr. D participated in those activities as well. So I know there's some attendees here today, and we talked about it yesterday with communication and sharing that story. So having producers and systems like Pipestone that are willing to bring those public health professionals out is really, really helpful. And again, you get to see some of the work that they're doing in the research space as well. So thank you again for that, Dr. D. And we'll come back and visit that topic some more once we reach the question and answer section. So now I want to introduce our final speaker, Dr. Dennis Erpelding. Dr. Erpelding is a consultant and speaker focused on global policy and strategic counsel regarding corporate affairs, trade access, food safety, antimicrobials, sustainability, and international standards. In 2018, he founded the Global Farm View LLC to provide strategic counsel to food chain stakeholders globally, taking a view from the farm to the consumer. Dr. Erpelding.
Thank you, Dr. Fowler. Please be a part of the panel and program here. What I want to do today is provide a little bit of an overview of some of the key learnings from the field, giving global poultry insights and reflecting on some of my global experiences. And can everyone hear me right now?
Yes, we can.
Okay, thanks. So I'm going to focus on 3 key areas. I'm going to touch on a little bit of the high-level stewardship approach, what the global poultry industry done, specifically the International Poultry Council. Second, look at the science and policy a little bit on how advice on relative government policy or industry policy. Then third, I'm going to turn to briefly a little bit on the labeling side about labelings and what's out there on a global basis. So as we look at, next slide, please. Okay, so look at the global policy, what's out there at this stage internationally. International Poultry Council over the last several years has recognized the need to have a stewardship program and be responsible in this process going forward. And so what they've done, they've actually done a 3-step process. First of all, they developed an antimicrobial stewardship use principles approach. Then they took that into the second part and elaborated in more detail, taking the position and looking at more of the science, regulatory structures, regulatory processes, stewardship, summary, and ultimately trying to get specific definitions so you could have common definitions on a global basis. Then the third part was developing a best practice guidance that was done more recently here at the end of 2019, looking specifically at things that can be done there relative to stockmanship, biosecurity, internally, externally, bird environment, hygiene, hatcheries, flock health, nutrition, stewardship, ultimately medication, and then growth motion data collection. So the International Poultry Council has recognized they've played a role or have a role to play globally on supporting responsible use. And as you look at some of the core stewardship principle aspects, there's a couple that really I want to highlight. Is one is they strongly believe in the need to do the risk analysis, scientific approach on guiding their stewardship. So looking globally, looking at a national basis, looking at a local basis, where's the science, do risk analysis, and then from that, develop policies. Those policies need to really understand how and why and when antimicrobials are used, which antimicrobials are used, how much is used, and ultimately transparency of communication around such. Then we've referenced a little bit on the best management practices, obviously looking at that on how we make sure those are implemented globally, and these are specific examples in a part 3 there of what they've done. The next one is obviously ensure you're complying with national authorities, recognizing internationally, globally, different countries have different regulatory processes and schemes, is making sure you're actually in compliance with whatever that system is, hopefully going above and beyond as the science would dictate if necessary. And finally, a specific example where they do is relative to the critically important ones for human medicine is making sure they're only used for therapeutic purposes under veterinary supervision, diagnostics, and oversight involved wherever possible. So those are examples where the International Poultry Council back in 2017 said, here's things that we can do as an industry going forward to manage our proactive stewardship efforts. And this is a continuing process that they have in place. And as they've developed the best practices, plans are to now take that into more of a training and implementation program globally, looking at what's happening in the best practices in any individual part of the world, saying how do we translate that to the global part of the world. So that's a little bit on the stewardship part. Turning then secondly to the science part and the risk analysis. And this is a slide I've actually developed over time. It's one I actually used to use back when I was at the Elanco, but I've adapted it. But this is as you sit down with governments, looking at laws, regulations, guidelines, is you look at trying to differentiate what we call medically important. If you look at the left-hand side of the slide here, medically important for humans, which would be human use only. Medically important for humans, those that might be used that are shared class that might be used in human and animal medicine. Not medically important for humans, some that might be a shared class, but will still use in human and animal. And there's those that are not medically important for humans, animal use only. This is trying to provide guidance as you sit down with governments and companies and say, what do you do to be responsible? I think we all recognize there's certain antimicrobials that are not used in human or not used in food animals now that should not be. Therefore, they should just be protected for human use on an ongoing basis. The next group, if you go down though, if you look at the medically important ones, if you look at whether you look at therapeutic uses, treatment control, or prevention, under the medically important ones, we talk about where they can be allowed, and then we'll kind of go across and what kind of controls should be across the way. But basically, for treatment control prevention under therapeutic, theoretically, other than those that are only medical use in humans, they could be used for in animal use as well. Growth motion, I think there's been a lot of sensitivity on that globally. This could cut across all species. I think the bottom line, if they're medically important, I think most people scientifically have come to the consensus they should not be used as growth motion pretty much everywhere in the world. And that would be specifically in the poultry industry. I think they're basically are not used anywhere in the world. If you look at the non-medically important others, there could be a role based upon risk assessments. Obviously, that needs to be done with stringent regulatory criteria involved, scientific analysis. Going on to professional involvement, professional veterinary involvement, I think we all recognize the need for medically important. There needs to be a veterinarian involved. As you get more globally, sometimes countries do not have the infrastructures, so we need to be realistic about what can be done here, but ideally have medical professionals involved, a veterinarian, veterinary assistant, some other people with veterinary training or understanding of medical use. And ideally you have a veterinarian involved, but not necessarily dictated in all these areas as you look across here. Things have been touched on a little bit here in different manners. A bit if you look whether you look injection, orally, medicated, feed, medicated water. Again, looking at what could be used theoretically under the right use controls, all these can be used in all those various categories. Then you come into the discussion about continuous use. And obviously, there's been different practices within regulatory bodies here on what can be allowed. But I think generally more and more right now, we're saying if it's medically important, it should not be a continued use product. If they're not medically important, you look at the risk assessment, determine how you can best address the specific disease. Then from that, determine what would be the appropriate use on quote continuous and or how you do that in the process. Then if you look at concurrent use, are there any times where you'd have two antibiotics used at the same time? I think generally the effort would be to say no, especially for those that are medically important. But again, if they're not medically important, if you have a veterinarian involved and there's a specific disease need, a specific disease purpose, then under professional oversight, you might say there's an appropriate role. So this would be something that I've worked with the poultry industry, but even more globally with other industries where they're looking at swine, cattle. This is kind of a diagram I put up and say, here's a good starting place of saying, here's where the science is, now determine where you want to do from a regulation, from a law, regulation, guideline, or ultimately individual best practices, stewardship use principles. So that's a little bit on the science side. Now we'll turn to part 3 on the labeling. And I kind of break this labeling into the 2 parts. This is looking at it from a global perspective. On the left side, you see what I call, as we think about labeling, we have what I call choice, and we call fluency. As you deal with many parts of the world, and I spent a lot of time in many developing countries, initially people are just looking at how they feed themselves. So they're looking at basically caloric intake. Next, if they have a little more fluency, they're probably looking at how nutrition they have. If they're really, you might say, fortunate, they can look at safety. Then you come into what I call the luxuries of affluence globally, the convenience factors, diet composition, and what I call production practices. So generally, if you look at consumers globally, my sense is a lot of the population is still down on that lower left-hand corner, but you do have the more affluent societies, the United States, Europe, some of the developed, well-developed worlds, and even developed parts within a developing world that basically do look at the convenience, diet composition, and production practices. So I think that's what I call into a little bit of a consumer choice about what's appropriate there. And that's going to come into my last point then around the labeling is, as we look at labels out there, if you look at the right-hand side, you look at the different labels that are out there, and these are in the US, they're parts of the other world, and you think about the consumer hat, and I think about the terminology about no medically important antibiotics, no critically important antibiotics, no growth promoting antibiotics, raised without antibiotics, antibiotic-free, organic. I would ask all those in this call and say, how many think actually the consumer is going to understand and differentiate, underline, understand and differentiate what those different terminologies are? Is my sense in many ways, if we're not careful, we're creating confusion in the consumer mind. So my counsel as we look at our labeling is how do we really streamline that, simplify that, make it so it's more an informed way. And I think one example that's out there more recently is the One Health certified approach, the responsible animal care, where they're trying to integrate these into a holistic approach on not only antimicrobials, but it could tie into animal care and other practices. So I think that would be a challenge I leave with the industry and those involved going forward is how do we make sure our labeling does provide information for the consumer that's of validity to them that really helps them understand what we're doing in food animal production. So with that, I would just summarize, I think, importantly, we need to make sure we do responsible use. We need to make sure we're doing stewardship globally. We need to follow the science. We want to take science risk-based approaches as we look at not only government processes, but importantly, stewardship processes. And then when it comes to labeling, let's make sure it's informed labeling and one that consumer can understand. And with that, look forward to joining with others on the discussion questions. Thank you.
Thank you. Are we going to stop the screen share and then have our panelists turn on their cameras? Here we go. Now we have the traditional Zoom arena kind of layout. So perfect. Thank you so much to our panelists. We did get a couple of questions come in during the break, all very informative, all great to hear what the different species are doing. We heard about dairy, veal, swine, some poultry in there at the end, beef cattle, etc. So starting first with Dr. Flynn, there was a question that came in just as I was transitioning out of our Q&A where someone wanted to know about kind of enforcement activities around the VFD. What does that look like? Where is that information summarized? Has the FDA identified loopholes? This person asked about type A, type B, type C medication, feed grade medication, if you don't mind kind of answering that question.
Yeah, sure. Thanks, Heather. Yeah, so I think looking at the two questions, one, I think I confirmed, yes. I mean, there is it's sort of the nature of how the statute related to veterinary feed directives is written, that it does specifically sort of speak to authorizations with regard to the use of a drug that's determined to be a veterinary feed directive drug. So it does create this sort of interesting dynamic where, which is somewhat different than sort of prescription status per se, in the sense that type A medicated articles, in fact, can be distributed and without a veterinary feed directive authorization, but ultimately they can't be used without a valid VFD. So understanding that confuses matters a bit because it's not quite aligned with sort of our notion of products that are designated as prescription. With regard to the enforcement aspect of this, we actually have done, albeit limited, we have done some inspections and have incorporated a VFD component into essentially our feed inspections or feed mill inspections that we had been doing prior to the VFD rule update. We did do a summary report that sort of summarized, and I think this was for the 2016 through 2018, where we kind of summarized what kind of findings we found through that inspection. And certainly I can, forward that link or provide that link if for more information. But I mean, generally speaking, the results of those inspections found that for the most part, folks were fairly well aligned in compliance with the requirements. A subset of those inspections, we actually did sort of a forward and back sort of inspection, so to speak. In other words, that a fairly limited number of inspections where an inspector went into a feed mill, they would examine records at the feed mill, but would also then sort of go back to the authorizing veterinarian and sort of look at, sort of the records there, and then forward to the farm to which that feed was, dispensed, essentially, to look at records there. That was a fairly limited sampling, but nonetheless, overall, the findings were fairly limited. I think there may have been one warning letter, I believe, issued in 2018, which I think was more directed towards a sort of administrative, error or failure with regard to a feed mill. So I can certainly try to provide the link to that report, which is actually on our website.
Thank you. And then a follow-up question, and this is for the panel as a whole. And so I should start by saying I am a true One Health champion, and I try to encourage others to fully embrace the One Health approach. Though I can see at times what I love about the One Health approach, right, is we look at human health, animal health, and environmental health, and we balance it. But I can see at times the scales tipping in one direction, often in the direction of human health. And what we saw with our panelists here as we talk about stewardship, doing our part to address the issue of resistance in the animal health world. So just wanted to get your thoughts first, Dr. Flynn, and then hear from the panelists. Are we tipping the scales too much in one direction? Resistance can and does affect animal health. Are we truly moving forward into a One Health approach with that? I'm thinking of some of the changes that you mentioned forthcoming with the classification of medically important drugs as medically important for human use. And Dr. Eberling at the end talked about those kind of shared class drugs. So how are we really balancing that to making sure we're protecting man and animal alike?
Yeah, I think that's a good point, and I think it does go back to, and it's relevant to the, to this idea of medically important, and I think that's why, and partly why I think the update that we put out now in terms of the draft, in terms of how we're revising that process, this is an important aspect of that, is that we're looking at that as a way of guiding risk management to try to with this idea that all antimicrobials are not created equals. They're not all contributing to the same degree in terms of our public health risk. And therefore, we shouldn't necessarily lump them all together and say, well, we're just going to apply the same risk management strategies to everything that's an antimicrobial. Further challenging that is the fact that, unfortunately, the vast majority of antimicrobials that are being relied on are, in fact, shared. I mean, we're relying heavily on the same classes of drugs that the human medical community is relying on. So that's just a fact of where we are. And so I think it's important, therefore, that there is a bit of a balance there. We can't just say, well, we're not going to use medically important antibiotics, because that leaves very little option for animal health. So I think clearly that's something where we have to pay careful attention to strike the right balance there. And again, that's what we're trying to do. We're not trying to eliminate or completely remove access or restrict access. It's just what can we do to try to basically optimize, use these products as best we can, but still maintain their availability.
Others on the panel care to comment?
I think well said by Dr. Flynn. I appreciate that very much. My only comment to the question, Heather, would be the environment is an untapped area of resistance. And I think we have to understand what's happening at the level of the environment and what those environmental bacteria are doing and have been doing for millions of years. And how does that activity influence the animal and the human? I saw many interesting observations doing the environmental sampling at the playground, the waste treatment plant, this pig farm, et cetera. That was a real eye opener for me because I didn't realize all the swapping that was going on at the bacterial level of drugs we would never use on a pig farm. For example, we'd find chloramphenicol resistance in bacteria at a pig farm, which of course you're never going to use chloramphenicol at a pig farm, but it's a metabolite from a species of Streptomyces. So there's going to be this interaction. It's a big black box. I think we have to really understand it to have the true One Health approach.
This is Dennis. I'm willing to build on those too. I think if you look at globally, and I've been involved, first involved in this actually, I think probably when I met Dr. Flynn the first time is the mid-1996, about the time we're doing a veterinary feed directive in the United States. I would say globally, this has definitely gone through cycles. My sense is right now we're better at having the science in the forefront. I think, Dr. Flynn, your comments on this question, I think were very appropriate. Is really trying to understand there is a need on the animal side. There's also a need on the human side. So how do we better differentiate those that are even medically important? And how do we place the right stewardship controls on those that are medically important to ensure their viability, not only on the animal side, but also the human side? And if I put the global lens on this, you've got basically globally, you have these things evolving at different parts in different countries. So we just need to recognize the US, I would look at as typically being good leadership on taking the risk analysis approach. And the more that can be modeled globally is to the advantage of everyone involved. But I think it's really doing that risk analysis approach, tying that back into the stewardship approach. And I think, as Dr. D pointed out too, is really understanding all these things, as it's not a simple human animal environment. There are some things that we need to better understand of the real science behind the interchange of those three things.
Thank you. So another question we had was during Dr. Capel's presentation. One question was specifically, what changes in dairy cow management do you think contributed to improvements in the somatic cell count? Also, how do we improve overall responsible use in management on dairies? And I think that can directly overlap with you, Dr. Haven and Dr. Capel, in terms of what interventions we've rolled out to improve stewardship. And if others have comments, feel free to join in.
Sure, I guess I'll take the one on mastitis reduction. Mastitis is a multifactorial disease. There's lots of different things on the farm that influence that. And I think we've gotten a lot better at stall and facility design. I think we've gotten better at selecting the appropriate bedding substrates for cattle. We do a much better job now at maintaining milking equipment and understanding when milking equipment is incorrect or not ideally suited and regulated for the cow. And we also do a much better job with getting into the milking parlor itself and doing milker training and actually going through all of the different steps of preparing a cow to be milked and unit attachment. So I think it's really hard to isolate any one component. I think we just do a better job of getting into all of the different areas of the farm that might impact mastitis and improving those areas on the farm.
I think I can comment on the question on antibiotic use and where we can continue to improve. So we do some work, of course, within cow production systems, but in dairy as well. And I mean, there's a lot of instances where if you ask a group of veterinarians when the right time to treat with antibiotics is, you get a lot of different answers. And so I think there's still opportunity to better define when antibiotics are necessary, and better define when they're not necessary. And I also think there's opportunity to further train as Dr. Flynn stated, the end user of antibiotics on farms. So of course, it's that producer that's often has to make that decision on when to use antibiotics. So I think there's a lot of opportunity to relay that information to the producers and give them decision tools to support that decision so that they better delineate opportunities to antibiotic use where it's necessary for animal health and areas where they can avoid antibiotic use.
Great. So I've heard from you both. Essentially, we've been implementing preventative strategies that help reduce our overall need for antimicrobials, but there's still some opportunity to continue to train folks on when exactly to decide to use antibiotics, which one, duration, focusing in on which animals to treat, etc. Any other questions? So a question just came in. Can Dr. D talk more about how regulators should think about or approach an environmental sampling program? How can sampling be devised to provide useful data? Under the One Health banner, there's more interest in studying the environment. And I will say we will be covering some environment tomorrow as part of the kind of One Health approach for this meeting, but in case you aren't able to join that, that's definitely continue to have that conversation. So Dr. D.
Yes, I'm a novice in that area. I think it's an area that needs a lot more exploration. And so I'm just kind of speaking on what I've learned the last couple of years. And I think what needs to happen is, well, basically what we did was developed a sampling protocol where we could recover the 4 NARMS pathogens on a regular basis. We validated that, and then we can use the NARMS antibiotic sensitivity testing panels to look at gram-positive and gram-negative resistance. And so you have to build the program from the ground level and make sure you can find the organisms, and then make sure the lab can actually test to look at susceptibility or resistance. So that to me is a building block. Now we've got that in place, and now, as I briefly talked about, we're sampling large numbers of farms, doing this on a routine basis, building a database of frequency of recovery and susceptibility and resistance patterns across the NARMS and the pigs. Then we'll be able to start asking some statistical questions onto what's significant and what's not significant here in this large data set. So we're not there yet. So I don't really have a perfect answer for the really good question, but it starts at the farm level and really trying to understand how to find the bacteria and then start to build the database.
Thank you for that. And thank you again for your call out during your presentation. Again, now, Dr. D, for the NARMS pathogens. In general, the NARMS program focuses on specific samples, and as researchers continuing to look at it in different spaces where maybe NARMS doesn't currently reach, I think it adds additional information that can further direct those activities in the future. So we appreciate your kind of commitment to public health through that work. I want to take the time now to thank our panelists today who helped us discuss kind of on the field with various species the topic of antimicrobial use and resistance. So thank you so much, panelists, and I will pass it over to Eric and Leah.
Hey, thanks everybody for sticking with us, and what a wonderful group of presenters we had. And again, Heather, thank you for moderating, and thanks to the rest of the moderators. Thanks to all of you for sticking with us and hearing these wonderful presenters. I just want to do a quick recap. I really heard 3 kind of common themes, and I heard a lot about monitoring, I heard about prevention, and I heard about stewardship. And I think even more importantly, I think there is this overarching kind of theme of continuous improvement. And I think that's probably even the most important one. One of the things that I heard is we're doing a better job. We're doing a better job collaborating across species. And when I'm saying species, I include humans in there. Humans, companion animals, poultry, aqua, livestock. And we're even beginning to bring the 3rd piece of One Health in there. And I heard us begin to talk about the environment and how the environment has an impact on antibiotic use, antibiotic resistance, and stewardship overall. I just wanted to hit some key points before we talk about tomorrow, and just some things that I heard. One of the things Alisha said from CDC was resistance is outpacing the new drug development. And so preventing the spread of antimicrobial resistant organisms is really important. We need to contain these diseases through detection, infection control, and contact screening, and sort of that cycle. We heard from USDAARS. We heard several things that they're doing and lots of projects that they have going on to strengthen surveillance, to do better diagnostics, and also to come out with new antibiotics, other therapies, and vaccines. We heard from the companion animal side. Forgive me as I flip through my notes just a little bit, and really focusing on advocating for a system to care to prevent common diseases. And one of the things that they have as a tool is a companion animal prescribing guideline. And they're using some of the antimicrobial use data that they're collecting to improve clinical decisions. So again, it goes back to that continuous improvement. We also heard from AVMA and the report on AVMA on the antimicrobial resistant pathogens, and really in an effort to help us in the veterinary community help improve our stewardship. Again, it's kind of that education, it's that knowledge, it's about doing a better job moving forward. We heard from FDA and their risk-based approach focusing on drugs of highest importance to human health, and also the antimicrobial use data and that project that's been going on for 5 years, and that report should be coming soon. So we will all look forward to hearing more about that as that report becomes fully available. We heard from several of the livestock species. Veal is really doing a lot of focus on in-person training and in-person training with producers, really looking at clinical evaluation and making the right decisions, both for the animal as well as for human health. And again, that goes back to that continuous improvement. I think you heard very similar, and just to segue, I'm going to jump over to beef for just a minute. I think you heard similar things from beef, and they're really focusing on some education, really working with the crews to identify and select the appropriate antimicrobial. Then they're also going back and tracking that data and making sure that everyone is in compliance with the guidelines as well as the rules and regulations in place. On the dairy side, really focusing on clinical mastitis, because that is one of the highest incidents of diseases of dairy cows, and which treatment and control of mastitis accounts for, I believe it was 2/3 of antimicrobial usage. So again, looking at where's that lowest hanging fruit, where can we improve? That's certainly an area of improvement. And they offered pathogen-based mastitis therapy as well as selective dry cow therapy. And one of the things I really appreciated hearing from all of the species groups was they're not focusing simply on reducing use. Rather, they're focusing, yes, they're looking at reducing use, but they're also keeping animal health and welfare in mind. And I think that's really, really important, that we can't just reduce use to reduce it and to say we did. We need to, if we're reducing use, we also need to keep that animal health and welfare in mind. And I think that's so important. We heard a bit from pork and the Pipestone Antibiotic Resistance Tracker, which is really tracking and benchmarking antimicrobial use by farm. I thought that was really a helpful tool for the farm to see where they are as compared to other farms. And maybe if they're not doing or relatively, and looking at other farms, maybe there's some things that they can improve on, taking a look at their management system and protocols. Pork is also doing some AMR surveillance on the farm and tracking resistance over time, plus tracking AMR in the environment. And they're also working on the Imagine project that's combining many of those items. Global poultry. Several things that the International Poultry Council, and because I was involved in some of these conversations, I can tell you those documents are available on the International Poultry Council website, but really looking at stewardship principles and creating some common definitions and looking at it globally complicates things just a bit, because the terms that we use globally may mean something just a bit different. They did put together a guidance to reduce the need for antibiotics, and that really includes best management practices. They really wanted a risk analysis and science-based approach to the use of antibiotics. One of the other things that was mentioned by Global Poultry was the labeling, and making sure that our labeling, and we're labeling meat products or animal protein in general, for informed consumer decisions. And it goes back in part to what we were talking about yesterday, making sure that whatever we're saying really does resonate, but also the general public understands what we're saying, as some of the labels that we use here in the US can be somewhat confusing. The other thing that was mentioned is we do have to be careful that we don't implement some of our choices on those who will be priced out of the animal protein market. So we really have to think about how does what we believe in the US to be the path forward, how does that really impact lower income countries, and is the regulation or is the framework even in place to do some of those things? So again, overall, great presentations. I want to just say thank you to our sponsors one last time. We couldn't do this without you. And I want to give a brief recap too about tomorrow. We're going to be exploring antimicrobial resistance and stewardship as they relate to environmental health and global conversations. And we started those global conversations, I think, today on the poultry side. We'll be hearing from EPA, academia, USDA, US Department of State, and US Department of Health and Human Services. With that, we will see you tomorrow at 9 a.m. Central. Looking forward to our agenda. Thanks again. Have a wonderful evening, everyone. Have a great night.